right there. So we will continue in infection control this morning. And about the last point I made yesterday was the idea of, or the concept of universal standards to treat all persons and body fluids as if they are infectious. Whenever we have a definition in our slides in red, you should be able to quote that verbatim. Okay. Don't get into paraphrasing or anything like that. There's only one way to make absolutely sure that the teacher understands that you are correct in that answer, and that's by writing it exactly the way it appears. So get in the habit of memorizing these definitions like that. It's not that hard, y'all. We've got plenty of brain power. Okay. So that definition to treat all persons and body fluids as if they are infectious. Okay. And meaning that if it's a fluid and it comes out of somebody's body, you're going to be cautious about touching that stuff or coming in contact with it. When up in the emergency room, one place where I worked in Oklahoma, they the only place open on the weekends was the emergency room. We didn't have any inpatient wards. Well, we had wards upstairs, but downstairs on the first floor, the only thing open was the emergency room. So people would try to come in or would come in on Sundays and they drop off their labs at the emergency room, kind of like thinking, I don't know, that they'll be first to be processed on Monday or something like that. I don't know why people did this, but they would bring their labs in on Sundays and drop them off in the emergency room, try to get them in early, I guess. And then there wasn't no problem for us. We would just take them down and put them in the lab for them. But this one guy, this dude came in, y'all, and he said, oh man, he said, yeah, I want to drop off my labs, my lab test thing. I said, yes, sir, no problem, we'll take that. So he picks up this paper bag, man, and he goes inside this bag and he pulls out a stool cup. Stool samples are collected in a wax covered paper dish. Oh, it's about that big around and, about that deep with a little lid that snaps on there. So he pulls this thing out the bag, y'all, and there is diarrhea just covering the side of this thing. Okay. Like, there you go. And I was like, just 1 second. So I reached over and I grabbed my biohazard bag. I said, you're going to put that in there for me. Okay. He put it in a zip down. Now he had feces all over his fingers, had to be under his nails and dot, dot, dot. And I just mentioned, there's a bathroom right over there. You can go in there and wash your hands. Well, I was going to get him and walk right out the door, y'all, with shit just all over his hands and under his fingernails and carrying on. So anyway, people out there just don't follow these rules. Okay? Or he was an older dude, so he might have been senile or something like that. But anyway, treat all persons and body fluids as if they are infectious. If it comes from a person and it's wet, it can carry disease. Okay? Those microorganisms we've been talking about. So that is the universal standard. It's been in place since about 1986 or so. Don't quote me on that year, but mid 80s. As a result of that, remember, I started in 1982. So as a result of that, I was out there practicing 4 or 5 years without the guidance of universal standards. And we didn't always wear gloves. Sorry, it's just not one of the things that we were taught to do. It sounds stupid now, but yeah, we smoked cigarettes too. So we did a lot of stupid shit back then. Okay. But we live and learn. And the problem is that we still have people who are my age still out there practicing. And they bring some of these antiquated ideas with them. It's kind of like when we talk about law and ethics and we talk about people who've been in the legislature for 30 years. You become complacent and you bring some of the old ideas with you. That's how things change. Young people step up, they bring new ideas with them. We still have people making our laws from who were been senators since the Vietnam era. See, those people need to step out. Let some young people step up. And that's when we see change. And when we're not going to see this kind of stuff considered universally by everybody until, unfortunately, my generation is gone. Those people who have been around long enough to, I remember when. I remember when we didn't wear gloves and dot, dot, dot. And as a result of that, most of us who've been practicing as long as I have had one of the hepatitis. For me, hepatitis A. So treat all persons and body fluids as if they are infectious. And practice spelling of each one of those terms. Hand washing is the #1 way to prevent the spread of infection. We mentioned that yesterday, one of the highest missed questions on the test. What's the #1 way to prevent the spread of infection? Hand washing. All right. Now, another thing another key for you is that if you ever see an acronym on one of my tests or one of my classes, I promise you it's going to be on your test. That's a gimme right there. So anything you hear acronyms, PPE, OSHA, CPR, any acronyms I use in class, they will be on the test. And there's your first one for this one, PPE. It stands for personal protective equipment. Now, one kid on the test, what does PPE stand for? And he put people protecting everybody. And I had to give him partial credit, y'all, because at least he got the idea. He didn't remember the exact words, but he knew the idea behind it. So I just went on and gave him partial credit. But know your acronyms. One of the reasons is so much that they forget what the acronym actually stands for, or they never learned it in the first place. My worst night or my most troublesome acronym that people use out there is HIPAA. They have actually no idea what that is. I mean, they know it's to protect patient information, but they always try to get the word information into the acronym itself. And they'll tell you something like HIPAA, it stands for Health Information Privacy and Protection Act. And that's not even close. It's the Health Insurance Portability and Accountability Act. As a result, and I've seen teachers teach that wrong. A student came and got me one day in my classroom and he said, "Mr. Malone, come here, I want to show you something." I said, "Yeah, what's up?" "Well, remember you was talking about HIPAA?" I said, "Yeah." He said, "Come on, look in here." I said, "No." He said, "Yeah." We looked in the classroom and it was written on the board, Health Information Privacy and Protection Act. Not even close. And that was a teacher who wrote that. So that's why I'm so big on acronyms, guys, because this is the basics and you need to walk out of here knowing the basics. So personal protective equipment, PPE, it's all over the news today. Everybody thinks of again as gloves and masks, but remember it also includes gowns, face shields, goggles, hair covers, and shoe covers. Anything that covers us to protect us. But remember what I said yesterday, this part right here, this whole personal part right there, that needs to evolve. They need to take that out and call this stuff protective equipment, because it's not only there to protect me, it's also used to protect you, my clients, and people lose sight of that as well. And that's why homeboy was so insistent about not putting gloves on his hands. They're there to protect me, and if I choose not to wear them, then that's my right. No, they're there to protect me too, Slick, and you're not going to touch me without them. So, and that's what people are kind of saying today. I have the right to breathe. Well, legally, your right is trumped by your responsibility by your social responsibility. So if we believe that exercising one of your rights truly puts other people at risk, we can suspend that right. People don't know how their own damn Constitution works. And where does that come from? That comes from a legal precedent where a guy from Haiti in New York City was practicing his religion in the basement of an apartment building. But it turns out that his religion involved sacrificing animals. Now, when they told him that he could not do that, he mentioned, I have freedom of religion. But the Supreme Court found that if your religion, religious practices, puts the rest of us at risk, then we can suspend that right. And there you go. So social responsibility trumps your personal rights. So yeah, I have a right to not wear a mask. It's my constitutional right. No, it is not. Okay. So people don't know their own damn rights or what they mean. So wear your mask, guys. There is just no reason not to. I have this little mask right here. It's got a foam strip on the inside, and that eliminates that one problem that a lot of people complain about. The mask fogs my glasses. This is a fog-proof mask. It's got a little foam strip right on the inside, and it keeps the air from coming up and fogging your glasses. So there's just no reason not to wear a mask. I mean, remember, it's all about protecting yourself, but the people around you as well. And the other thing in the news lately is that those little neck gaiter things actually work worse. I think I mentioned that yesterday. They are actually worse than nothing at all. I mean, worse than not wearing a mask is putting one of those neck gaiter things up there. So anyway, and you be diligent out there. If somebody's not doing their thing, stay the hell away from them and don't let them come near you. There was a lady in the parking lot just a few minutes ago, just walking past, and we're outside. I don't get really like panicky when we're outside with there's good circulation, but I still just kind of walked her and gave her a wide berth. You just take the road, lady, it's yours. I do the same in the malls. I'll stop and let you go ahead, man, it's your world. I'm not going to get within 6 feet of you. And if you come within 6 feet of me, I'm going to move quickly and give you one of them dirty ass looks and wait for you to say something. But remember too, guys, that people are getting stupid out there, real stupid. Do you know that I went to the store a couple weeks ago to buy some ammunition for my gun, and they were totally out. All the shells were empty. I went back to the gun cabinet, all the gun is empty. And this was Academy. They've always got stuff. Went back to the gun cabinet, it was totally empty. People are arming up out there. My daughter, I just took her to her concealed carry class just a couple weeks ago. I've been carrying a gun for years. I always will. But people are just getting stupid out there, y'all. You see the guy pull the gun on the person in the Walmart because they asked him to put a mask on. The lady who shoved the stroke patient down on the ground. So people are just, so don't be approaching people out there about masks. Just be diligent yourself and just stay the hell away from them. Because I promise you, there are people out there right now who are walking around with this attitude. I wish somebody would say something to me about a mask. I'm just waiting for somebody to say something to me. And they're just waiting for a fight. So either arm up or just stay away from them people. I will pop a cap in your ass, man. I ain't playing with you. You pull a gun out on me at a damn Walmart, buddy, I'm gonna punk out. I'm gonna say, oh, please, please, Mr. Man, don't shoot me. And as soon as you put it away, I'm putting a cap in your ass and take my chances in court. These people are getting stupid out there. The flea market just this past weekend. Did y'all see that in the news? 2 vendors got into an argument and started shooting back and forth at each other. And this was just at this flea market up on a little ways out, 90 past Poteet. So people just getting stupid out there. So don't be approaching people about masks and stuff like that. Just be diligent, stay away from them. But there are people out there who are just waiting for you to say something so they can start acting a freaking fool. All right, so anyway, be able to list 3 examples of PPE. Gloves, gowns, masks, and you're good to go. Okay, face shields provide some protection for us, but face shields don't provide a aerosol protection. With a face shield, we're talking about stuff that's splashing up at you, like you're doing an ear wash on somebody and the water's splashing out. You are in an emergency setting and there's a lot of blood and there's a chance that something could splash up in your face. So face shields protect us from splashes, not from aerosols. Let somebody breathe out. You notice the whole side of that thing is open. How is that protecting you from what somebody's breathing out? Okay. And the barriers they're putting up at the Valero, the little plastic barrier hanging down in front of you, that's good for, again, somebody coughing in your face or something like that. But for general breathing, no, it goes right around that barrier the same way it does anything else. Air flows pretty damn well. Now, the lady at our Valero, she's really diligent, y'all. She stands behind her little plastic shield. She wears gloves. Yeah, she wears gloves. So that when I hand her money, when she gives me change, does she change gloves when the next person steps up? No. It doesn't do any good to protect us. It might protect her hands, but that stuff on those gloves, she's just passing it back and forth between people. And then there are those companies out there that say, well, we don't give change. That's the biggest crock of bullshit I ever heard in my life. I went down to the Taco Cabana and I bought 3 tacos and it came out to $3.20. I gave the lady $4 and she said, thank you. I said, where's my change? Oh, we don't give change. Oh, but you'll take those $4 from me. What are you talking about? So you better give me my change or give me my money back. Well, our policy today is that we don't give change. Okay, but you'll take a damn debit card from somebody. You'll take dollar bills that I hand you, but you won't hand me change back. Give me my money back. So she turned around and said, oh, well, I'll give you change this time. I said, no, you won't. You're going to give me my money back because I'm not going to do business with you. Give me my $4 so I can go on about my business. We don't give change. Whatever, man. It's just a ploy, guys. They're taking your money. If they don't give change and my order was $3.20, why didn't they just charge me $3? I'm supposed to eat the 80 cents. Anyway, but they don't give change. So anyway, your PPE, guys, be able to give at least 3 examples of PPE, and there they are, gloves, gowns, and masks. Any of the others are acceptable? Just 3 examples of PPE. All right. Now let's get back to that instrument, the one that I want to use to do surgery on you. But I just walked in and picked it up off the table. Or I just used it on somebody else. I did surgery on them with this. Now I'm finished. I don't want to throw it away. I want to use it on the next patient. So how do I get this thing ready for the next patient? The first thing we're going to do is sanitize it. Sanitize is what you call when you do clean something with just soap and water. So when you wash dishes at home, you're sanitizing the dishes. Every time you wash your hands, you're sanitizing your hands. So I'm going to take this thing over to the sink. And in most places, you'll have what's called an instrument sink. It's only used for doing instruments. And you'll stand there at the sink and you will wash it like you wash dishes, like you wash a fork or a knife at your house with soap and water. Now we use scrub brushes, just like y'all use Brillo pads at home, or those little green cleaning pads to move stuff that's stuck on there. So we can get our brushes and we're going to get that thing under the water and we're going to clean it to where it looks clean. We're going to clean it to the eye. We're going to look and make sure there's no dried blood on there, no debris, especially if it's a hinged instrument. Looking up inside the hinged part, making sure there's nothing up in there that we missed, and being pretty diligent about scrubbing that thing. Always think of it this way. This could be the instrument that they use on me or somebody I care about. You know, I knew a guy who was, this was our station over at Fort Sam Houston. He was what they call a jump master. He's the one that teaches people how to parachute out of airplanes and things. And the shop where he worked, they had these really long tables where they would stretch these parachutes out, and they would roll them and fold them and pack them into the pack. And it's got to be done a certain way. If that thing isn't in there right, when you pull the ripcord, the parachute won't come out, and you die. So it's a pretty serious thing, and they're packing these parachutes. And he told me one day that what he does for quality control to make sure that people are being diligent about packing the things is that every few weeks or so, he walks out, he tells everybody in there to grab a parachute from the rack. And we're going to jump today. And he makes them jump with random parachutes that they pack. That's quality control right there. Okay. So every time they're rolling one of these parachutes, they're thinking, this could be the one that I end up jumping with. This could be the instrument that somebody uses on me. Be diligent about cleaning them bad boys. Look for dried blood, debris, whatever, and make sure it's clean to the eye. Every now and then you'll come across an instrument with a stain on it. Take it to your manager. Get it out of rotation. Stainless steel does rust, by the way. If you've ever heard the terms surgical steel or stainless steel, they don't rust. Yeah, they do. Especially up in what we call the box lock, the hinge for scissors and clamps and things. Look up in that hinge. Sometimes you'll see some rust up in there. Take that thing to your manager, get it out of rotation. All right, it's time to be replaced. All right, so be diligent about cleaning the instruments with soap and water. Now we can sanitize again our hands, surfaces, whatever we're washing with just regular soap and water. We're sanitizing it. So now the thing is sanitized. We know it's not ready for surgery because we've only cleaned it to the eye. Remember, the stuff we're worried about can't be seen with the eye, but it's clean to look at. The next step then is to go on and disinfect it. And we're going to disinfect it by dropping it in an approved disinfecting solution. It usually sits in a little bin right next to where you do your instruments, the sink. So you sanitize the instrument, you look at it, you make sure it's good and clean, you check up all in the hinges and on the serrations, the part that actually grab the tissue, and make sure there's nothing in there, it's nice and clean. Drop it in the disinfecting solution and let it sit there for whatever the prescribed time is, usually about 15 minutes or so. And that's how we disinfect an instrument. We get the solutions from the workplace. Where I worked, we used this stuff called Gluta-Hex. It was a green little disinfecting solution right there in the bin next to the sink. It had a little cover for the little bin and all that. You open it, drop the instrument in, cover it, let it sit for 15 minutes. Now, when you come back, you're going to take that thing out and rinse it and get it ready for the final stage. Now, that's how we disinfect an instrument. Now, how do we disinfect tabletops, surfaces, things around your house? We disinfect with, again, disinfecting solution, but it can come in the form of wipes. They're out of Clorox wipes, y'all. Yeah, they ran out. The reason they ran out is because the wipes are made out of the same material that the surgical masks are made out of. And with the demand for surgical masks, all of that material has been redirected to the mask people. So the wipes people aren't getting any of the material. So they're running out of wipes. I guess it's a good thing my little daughter works at Walmart. Yeah, we get all the good stuff. Yeah, she came home this morning. Dad, I brought her back a thing of wipes. I was like, well, good. Nobody else can get them, but hey, I got the connect. All right. So anyway, you can use the disinfecting wipes. I'm sure that in the 1980s, when the CDC said the best thing for cleaning up or getting rid of microorganisms is bleach, boy, I bet the bleach people just was dancing in the aisles, y'all. We just said that everybody in the world needs my product. You know, the stocks went up and people were dying to buy into bleach or whatever chemical companies. So anyway, and that's it, guys, 10% bleach solution. If you don't have, and people, it was a little story on the news the other day. I didn't even watch it because I knew what they were going to say. They were talking about the shortage of wipes and what you could do in place of wipes. I said, they're going to talk about bleach. 10% bleach. And it's what we use before wipes. And it's what we use today when you run out of wipes. Take a regular little spray bottle. You can use the ones that you buy at the store to spray for like plants and stuff. You can use those. Take 9 parts of whatever you're using to measure. Put 9 of water and then 1 of bleach. You got 10% bleach. So when you're at work and you run out of wipes, what are you going to do? Somebody run down to HEB, buy a bottle of bleach. If we don't have some under the cabinet already, because we usually do. And make up some 10% bleach loose and get these tight tables wiped down. It's not a big deal. So 10% bleach. And for you, this statement right here is very, very important. Because on any testing, they're not going to use the word bleach. They're going to use the word hypochlorite. Know that word. It is bleach. Know it. For example, on your certifications test, the most widely accepted disinfectant, if you write bleach, they're not going to mark it correct. Hypochlorite at a level of or a mixture of 10%. Now that 10%, if you ever take a test with me and I say, what's the most widely accepted disinfectant? If you write the word hypochlorite, I'm gonna give you half credit. It's only half the story. The 10% is important. One day I came, this guy asked me to cover his class one night. I said, sure, what do you want? I said, oh, well, I want y'all to draw blood tonight. All right, I got that, no problem. So I came in that evening, we did the class, we drew blood all evening. When we got done, I said, okay, y'all, let's get these tables down, get out, wipe down, get out. Okay, and they started wiping down the tables. About 3 or 4 minutes into it, my eyes started to burn, my throat started to burn, my nose was burning, and I finally said, what? Whoa. What mixture are y'all using? You know it's bleach, but what mixture are y'all using? Oh, we use it right out the bottle, sir. And it's like, why are you doing that? Because that's what a teacher taught us, sir. So the next time I saw that man, we had a conversation about that. So tell me, what do you have the students wipe the classroom down? Bleach. I said, what mixture? Oh, we use it right out the bottle. I said, why are y'all doing that? He said, well, if 10% is good, 100% is better. I said, don't you know that bleach irritates the mucous membranes of the nose, the eyes, and the throat? Sinuses burn. It's dangerous. Stop doing it. And if you don't know that, then I have to ask, what else don't you know? Now, see, this is me sitting in my office talking to people, y'all. I don't have time for this silly shit. And I'll ask you, if you don't know that, what else don't you know? That's simple stuff. That's what we learned on the first day. Would have learned it yesterday, we'd went a little bit faster. That's what we learned on the first day of school. What are you talking about? So anyway, that 10% is important. So know that term, be able to spell it. 10% hypochlorite, the most widely accepted disinfectant. Now, if you need to go down to the HEB and buy some bleach to use at work, any old bleach will do. Just go buy the cheapest stuff that's on the shelf. Usually that little white bottle that says bleach on the side. That's all we need. And again, mix it in a spray bottle. Be cautious when you're spraying this stuff. If you're using a spray bottle, is the best way to do it. Be cautious about splashing some of that on your scrubs when you're cleaning up, because it will leave those little white spots on your scrubs. All right. So that's the most widely accepted disinfectant, 10% hypochlorite. To disinfect something means to clean it with an approved disinfecting solution. So if you're using the Clorox wipes to wipe down the tables, then you're disinfecting the tables, the chairs, the exam tables, and so on. Has anybody ever walked into or went to see a doctor and they took you in the exam room and the exam table, actually get up on the exam table and the paper was wrinkled? Has anybody ever asked you to do that? Jump up on some wrinkled exam paper? Okay. Now let me tell you how that's supposed to work. Patient gets down, you tear off the paper, you wipe down the exam table. Only takes a few seconds to dry. You pull down the new paper, then you go get your patient. Shouldn't be walking in a damn exam room with wrinkled paper on the table. That should have been taken care of before they even took you in there. What kind of medical assistant are you going to be? And I've even told people, go ahead and say, "I'll have a seat up there, Mr. Mahone." No. Or before I get up there, I pull the paper down. At least when you know you should have wiped this damn table down. And the paper is wrinkled and you can see somebody's butt cheek prints in it, then you know damn well they haven't wiped down that table between patients. Does anybody think you might want to be the infection control person at your office or on your ward? You know what the infection control person does? Walks around and gets in people's ass about stuff like that. Yep. This is the person that walks up to you and say, "Hey, how you doing? All right. Yeah, listen, you work on this ward? Yeah, okay, listen, I'm Mr. Mahone from Infection Control. Would you come on down to the utility room and show me how you wash your hands?"
Sorry to interrupt, Mr. Mahone.
Go ahead, Jennifer. You turned your mic off. Go ahead.
Renisha Childs wanted me to remind you she has a doctor's appointment for her kid.
Oh, thank you. Thank you. Appreciate it. Let me get that in my notes. Okay. So as my wife, maybe about a month ago, she's sitting there. I said, "What's the matter?" "Oh, damn infection control come by today. And like, I don't know how to wash my damn hands. I've been a nurse for how many years? And Yeah, but you still went down there and washed your hands for people, didn't you?" "Well, yeah, you have to." Yes, of course you do. So that is working infection control. And it could be an additional duty for some of y'all. In other words, you're my new medical assistant. Guess what the new person gets? It's your job. You're going to be infection control. Okay. And you've been there a while, you get promoted or moved off that duty, they hire somebody new, they become infection control and you get to order supplies. So these are additional duties that come along with the job. So you could be the infection control person at your clinic or on your ward. And that's how we disinfect something. We use an approved disinfecting solution, and that's the second step. So the first step is to sanitize it. The second step is to disinfect it. So that instrument has been sitting in the disinfectant for about 15 minutes. I'm going to take it out with a pair of tongs. I'm going to rinse it over the sink with sterile water, and I'm going to set it on a clean drape over here to my left. Now it's ready for the third step. The third step is to sterilize the instrument. Now, we can't sterilize skin and that type of stuff, so sanitizing our hands is the best that we can do. We can't take them to the level of sterilization. That's why we have gloves. But we also have sterile gloves called surgeon's gloves. Y'all may not have seen those yet. They come out of a pre-packaged and they are absolutely sterile inside. You put them on a certain way so that you don't contaminate them. And you might have seen them on TV. Once they got the gloves on, they hold their hands kind of like this. And on TV, you know, they get kind of stupid. Ooh, I'm thorough, I'm thorough, I'm thorough. The truth is, truth of the matter, here's what you're going to do. Your sterile area is between your shoulders and your waist. Your hands never go above your shoulders or below your waist. And when we set up sterile trays, they need to be above the waist and lower than the shoulder. So that's considered the sterile area between your shoulders and waist. Everything that you handle that's sterile should remain at that height. And once you get your sterile gloves on, you fold your hands, you keep them away from your body, keep them above your waist and below your shoulders. And this is how you go through the door. If you're doing this, there's a chance your hands might touch something. Boom, here, away from the body, turn back through the door, go in and do your procedure. When you step up to the table, the instruments are right there above your waist, below your shoulders. So being diligent about maintaining sterility of something once it's sterile. Many of our instruments and equipment that we use, like catheters, IV catheters, needles for drawing blood, sterile gloves, they'll come prepackaged and sterilized already. And you will learn how to open those without contaminating. For example, how do you take a needle out of its package and put it onto a syringe without contaminating the needle? That's what your lab classes are all about. How to pass somebody or something to somebody that's wearing sterile gloves on their hands. How do you move that thing from the package into their hand without contaminating? How do you add liquid to a sterile tray? Doctor says, Mom, I need you to put some disinfectant in that jar right there for me. How do you pour that into the jar without contaminating the entire area? That's what you're going to learn in your labs, a sterile technique. All right, so how do we sterilize something when we have to do it? We're going to heat that thing up to about 250 degrees. Now, I can take that single instrument and say, okay, I'm just going to sterilize this scalpel. When we need a scalpel, we go over to the drawer, take it out and open the package and use it. Or I want to sterilize all of these instruments together, equaling what we might call a minor surgery kit, where all the instruments you need in there to do a mole removal or a suture or a laceration repair, all the instruments are come together in one sterile pack. So you might find yourself at that sink putting together a minor surgery kit. Going, okay, I need 2 forceps, I need a scalpel, a blade handle, I need 3 of these, I need 2 of those, putting all those together, wrapping them together, and then sterilizing them together. Some of our sterile packs will be huge and contain hundreds of instruments, like a hip replacement kit. Imagine how many instruments it's going to take in a 3-hour surgery to replace a person or put in a prosthetic hip. That could be hundreds of instruments, and they would come in a big pack, all packed together. Or a C-section kit. When it's time to do a C-section on somebody, we can't be running around finding instruments. You're going to take out the kit, open it up, everything you need is right inside. So we can sterilize individual instruments. We can sterilize large packs of instruments. Those drapes that we use in surgery, if you ever seen like a video or a picture of a surgery with all the drapes over the patient, all those drapes have to be sterilized. So they come in huge packs. So an autoclave, the instrument we use to sterilize, can be as small as a microwave. Just a tiny microwave that sits on the table in the office. And you do your little minor surgery kits in there that may contain 15, 16 instruments. But if you got to do the big packs or the big drapes, you might find yourself using one of these autoclaves. That thing is the size of a room. And you'll put in large drape packs and that type of stuff in there and sterilize that all at once. And this person standing right there to run that machine is probably making about $100,000 to $125,000 a year. So there are a lot of directions to go in healthcare, guys. And we'll talk about this a little bit more, but one of the things that I hate to see is that when you see a lady and who's in healthcare school, I promise you, any one of you tell somebody that you're just be general. So what do? Oh, I'm going to school for healthcare. And I promise you the word nurse is going to come up in that conversation. Oh, you're going to be a nurse? Oh, I've always wanted to be. Oh, I think you'll be a good nurse. Why? Because you're a woman. If I said the same thing to somebody, they would ask me if I'm going to be a doctor. The world still works that way. And I hate to see that out there. But there are so many directions to go in healthcare. Don't automatically think nursing. And you think, well, nurses make a lot of money. Nurses don't make $125,000 a year. You know who else makes a lot of money? Therapists. Physical therapists, respiratory therapists, music therapists, recreational therapists. I'm an occupational therapist. Make money too. So it's not just nursing. I hate it when people do that. All right, so anyway, that is your autoclaves. One is tabletop, about the size of a small microwave. You see there's not a whole lot of buttons on this thing. It's pretty simple. Open the front door, slide the instrument pack in there, close the door, push the button. These little buttons up here, these are for you to decide whether you want to do a single instrument or a pack of instruments. Whether instrument is wrapped or whether it's in a plastic, or not a plastic, but a paper sleeve. So that's all these little buttons are there for, to decide what type of instrument and what type of packing you're using. Slide that in there, push the button, run for 15 minutes. This little cap up top, pop that off, pour the water in, because this is a steam autoclave, which is the most common way to sterilize, with steam. Now you can also use flame, as long as it gets up to 250 degrees. It doesn't matter how you do it, except open flame doesn't go well in healthcare. And neither does big boiling pots. So we don't use flame, we don't use boiling water. We use steam. Now, if something is too sensitive, too heat sensitive to be heated up to 250 degrees, then they'll use gas or chemicals. You won't ever get into that. That's the stuff that's pre-packaged. The IV tubings, the IV catheters, the urinary catheters, those things come to us pre-sterilized. They're made out of rubber and plastic. They can't be heated up to 250 degrees. So they use gas or chemicals to do those. The instrument that we use to autoclave, whether it is a steam autoclave, a gas autoclave, a chemical autoclave, that's the word, autoclave, the thing we use to sterilize machine. And we use the steam autoclave. Pressure builds up inside the machine. That forces the heat through whatever packing you have the instrument wrapped in. So when you wrap the instrument, it's a packing called muslin cloth. It's not paper, it's a really thin cloth, but they're disposable. So you wrap them in that and you stick it in this machine. And the pressure from that pushes the heat through the muslin into the instrument and heats it up. And there is a little tab that you put in with the instrument. When you put it in there, it's black, just a little strip of paper. But when you take it out, it's brown. And to show you that that did get heated up to 250 degrees. So it tests to make sure that the heat did get what it's supposed to be. So there are a couple of fail-safes for us in this. Another fail-safe is called autoclave tape. It's the tape you use to close the packing. So you wrap the packing up, you put a piece of tape on there to hold it closed, then you put it in the instrument, in the autoclave. The autoclave tape has these little stripes on there. And when they get up to 250 degrees, the stripes turn brown. So you have the tape on the outside and you have the tab on the inside, letting you know that the outside and inside of that package both reach the desired 250 degrees. So there are some quality control checks there for us to make sure that that instrument is sterile before we go use it on somebody. All right, so that is an autoclave, and the most common way to sterilize something is with steam. Okay? And there are your 3 levels of infection control: sanitizing, disinfecting, and sterilizing. All right, now we are missing a few people this morning, so we do need to go on and get this attendance done. Doggone it. These glasses must be different. Yeah. Where am I losing? Is my eyesight getting worse? All right, that's better. Yeah, man. Wow, really? Oh, man, these are not the same. I thought they were the same. I need to get rid of these. I can't see anything. Anyway, Miss Malone getting old. All right, so where's Roxanne Amaro? I see you. How about Talisha Brooks? Talisha?
Here. Hey.
Okay. Tanisha Butler, or excuse me, Karanisha Butler. Karanisha. No, okay. And Jordan Carter. I saw you earlier today. There you are. Yordell, you here? Yeah. And then Renisha had a doctor's appointment. Erica De La Rosa. Erica. Jennifer Green is here. Davion is here. Jaime is not here yet. Jasmine is here. About Linda, always here. Melissa is always here. Where's Melissa? There you are. All right. Vanessa is here. Pargas. Vidalia is here. Selena here. Angel Mira. Riojas. Angel, I see you. And then Alma Segovia. Alma. Here. Crystal, there you are. About Savannah, Wilborn is here. Dee Dee Wilson is here. And Angel Ramos. Where's Angel? Angel. Angel, do I see you? Do I see you? No. All right. So let me do this email. Right. So Karanisha, Renisha, Jaime, Alma, Angel Ramos, Erica De La Rosa. Going once. All right. Sent. All right. So the last slide in this part of the presentation. These are all scratched up anyway. Yes, I do have ADD. Sorry, I lose focus sometimes. So, and I sent the second part this morning. So that's the bloodborne pathogens part. You should have got the PowerPoint for that. We'll continue with that when we finish this. All right. So this is referred to as the cycle of infection. What it is it represents an infected person, and we need to treat that person today without, one, contracting the infection from them ourselves, and two, without passing it to somebody else today. And we have several chances to prevent that from happening. And each link represents a chance to stop the spread of this infection. Let's face it, we're going to have to treat infected people. That's all there is to it. Somebody coming to your clinic with HIV or hepatitis B or hepatitis C, we're not going to deny them treatment. We're going to treat them. But we have to do it in a way that we don't spread that infection. We don't get contracted ourselves. We don't spread it to anybody else. And each one of these links represents a chance for us to stop that from happening. So we call it breaking the link. If you can break this chain at any one of these links, infection won't spread. It won't happen to somebody else. All right. Now, the first of the links is called the reservoir. And this is our first chance to prevent infection from happening. A reservoir is any place where a microorganism can.
Mr. Mahone,
Yes.
it's Melissa Lucio. Did you count me present?
Yes, it did.
Okay.
A reservoir is any place where a microorganism can live. A sink, a wet sink, because remember, bacteria grows best in moist environments. So tabletop, a puddle of water, or the human body. If the microorganism can live inside you, then you are the reservoir. And the way that we're going to break the link right here, or break this cycle, is to eliminate the reservoir. Get rid of it, clean it up. If the sink is wet, dry it off. That's why you should always do a courtesy wipe of the sink after you wash your hands. Now, one of the techniques in washing our hands in healthcare is that we get our paper towels first. 4 or 5, however many you think you're going to need. You take that to the sink with you, you wash your hands, and your paper towels are right there. Always grab 1 or 2 extra, so that when you finish, you can take the last one and do a little courtesy wipe of the sink. Eliminating those reservoirs. So if the reservoir is a sink, a tabletop, or whatever, we clean that up. But what if the reservoir is a person? We can't eliminate the reservoir. It's a person. Therefore, that link will remain intact, and we don't get a chance there. There have been times in history where we tried to eliminate the reservoirs, the infected people. One of them involves a infectious disease that happened, that's mentioned in the Bible, and it still occurs today. Can anybody think of an infectious disease that's listed in the Bible?
Leprosy?
Leprosy.
Well, I don't know what it's called today, but I know in the Bible it's called leprosy.
Yes, leprosy. And it's still called leprosy today. And it still exists today. Does anybody know what they tried to do back in the Bible time to eliminate the reservoir? Leper colonies. They sent them out of society. Go live with others your type. And I visited a leper colony in Greece. It was shutting down. It was in the process of shutting down. They were turning the entire island into a tourist attraction. But there were still 12 people with leprosy who lived there. They had no place else to go. So they told them that they could stay their life there for the rest of their life. And they just isolated them from one part of the island. But they were still went forward with turning it into a tourist attraction. I was into cameras back then. I had, walk around with 3 cameras around your neck and, taking pictures of every freaking thing. They took us on a tour, and when they came by this big pit, it was like a deep well where the brick wall came up about 2 feet above the ground, and then this hole way down in the middle. And the guy said that that's where they used to throw the bodies of the lepers when they died, if they had no family to come and take care of them. So, this place has been there for hundreds of years. So just, you look down in the well, and it's totally black. You can't see anything. But I just decided, I don't know, just on an impulse, I took my camera, I held it up over the well, and I took a picture down into the well. When I got the cameras, when I got the film developed, you could actually see the bones, the skulls, all the bones laying at the bottom of that well. So that's a pretty cool picture. And I lost it when we came back from Greece. They lost it in some of my luggage and stuff. So the picture was in there. But anyway, go ahead.
Is the leprosy, is it contagious? Because actually just the other day I saw a lady, she had that at the HEB.
She had leprosy?
Yeah, because you can tell because it's like little bumps all over the body, right?
Yeah, leprosy is a fungus.
Yeah, she had like all over her body.
Yeah, I sincerely doubt it was leprosy, because it's also highly contagious because it is a fungus. Fungus is contact. So in other words, it's not respiratory, it's contact. You touch my hand, that's it. So that lady was walking around with leprosy, and yeah, that's a serious problem. And that's a real problem. That's why we isolate them, because it is so contagious. So, but yeah, it's a fungus that causes, and remember, fungus eats tissue. Remember the guy that had his eyes and nose removed? That's people with leprosy. That's why they always wear like these veils over their face, because their nose falls off, their fingers fall off, their toes fall off, their penis falls off, their ears come off. Because of the fungus. So anyway, when you can't eliminate the reservoir, then you have to proceed to the next link then. So I had a chance here, but the reservoir is a human being. There's nothing I can do there. I can't eliminate the reservoir. So I go to the next link. And the next link involves the portal of exit. How does this thing that you have, how does it get out of you? If you're the reservoir, then how does that thing get out of the reservoir? If it's COVID-19, how does it get out? We breathe it out. If it's HIV, it gets out through the sexual tract. If it's bloodborne, it comes out through a cut or an opening in your tissue. So how does that thing get out of the reservoir? And that's called the portal of exit. How does it get out of you? And how do we handle it there? We cover the portal. So you see, this stuff isn't new. If you have a respiratory something, you put a mask on your face and you cover the portal so that thing can't get out of you, or can't get very far out of you. Now, in this case, we need to draw this patient's blood. And the infectious agent that we're talking about is hepatitis B. It's in the blood. And we need to draw the person's blood. So what we're doing is we're actually creating the portal. So we can't cover it up. We need to use it. So we can't break the cycle right there. We're creating the portal of exit as part of our procedure. So the next chance then is for me to educate myself, know what hepatitis B is, know the risk, know how it spread, and so on. Know the signs and symptoms, and use knowledge to help protect myself a little bit. And use my universal precautions. Know what it is, how to effectively handle a person who might be infectious for something. But you see, me, I'm just stupid. I didn't pay attention. I fell asleep in class. Every time they do my bloodborne pathogens training, I don't pay attention. So the chance to break the cycle right there is lost because you don't know how to. So know the means of transmission, know how this stuff is spread, and you can better protect yourself. You can use your universal precautions. But me, nah, I'm just dumb. So I missed that chance right there. I'd say things like, I think I can draw blood without getting it all over the place. Okay. So then I have to move to the next level then, the portal of entry. How does the thing get from you into me? We know how it gets out of you. So how does it get into me? If you breathe it out, I breathe it in. The portal of entry is the respiratory tract. When you're talking about something like hepatitis B, the portal of entry is intercourse. But since we don't get in the habit of having sex with our patients, the portal of entry would be a hangnail on my thumb. And my silly ass doesn't wear gloves because I can do it without getting blood all over the place. Yeah. The portal of entry for me could be a cracked cuticle or whatever that bandage on my hand is covering. That's how it gets in me. It can splash up in my eye. So how does it get into me? If I know how from education over here, then I can cover the portal of entry. And I can cover up the cracked cuticles. I can cover up the hangnail. I can wear goggles if I think it's going to splash in my eye. I protect myself that way. But see, I'm a dumbass, right? I walk around saying things like, I can draw blood without getting it all over the place. Or I can't find a vein with gloves on my hands. Or you got bad veins. Let me tell y'all something. Don't be blaming me because you don't know how to do your damn job. I come in there and somebody, oh, you got bad veins. No, you have piss poor technique. I've drawn blood on the side. I've started IVs on the side of the road with traffic going by, ambulances in the background. I've done them on helicopters. You ever even been on a helicopter? I got that damn IV started though. I've done them in the back of moving ambulances. I've done them in the emergency room with people reaching over and around and under me. If you can't start a damn IV with gloves on your hands, you shouldn't be doing the procedure in the first damn place. Boom. And if I ever see you working for me, pull the damn finger off a glove, that's the last finger you ever pull in this clinic. Are you kidding me? Y'all seen them do it, right? Just tear the little finger off because they can't feel the vein. Yeah, you got piss poor technique. And then they blame you. Oh, you got bad veins. Give them one of these and ask them to send somebody in here who knows what the hell they're doing. Guys, you do not want to be the one at the desk when Mr. Mahal walks in your clinic. That'd be a good time to take a break. Oh, damn, that's Ms. Mahal. Hey, can somebody cover for me? Because I'm going to give you a hard time if you're not doing what you're supposed to be doing. I'm sorry. All right, so anyway, I missed the opportunity. I don't wear gloves out there because oh, I didn't use this word. We have a policy here. You ain't got no damn policy that says you don't have to wear gloves. And anytime they do say that, oh, we have a policy here that says, okay, can I see that policy, please? Yeah, you're full of shit. You don't have a damn policy that says that. Why do you think you have one? Because somebody told you that when you got there. So, I missed the chance to break the cycle right there. I didn't wear gloves. I didn't cover the port of entry. Now, as dumb as I am, I missed two opportunities that were just totally on me: knowledge and covering the portal. As dumb as I am, when I was hired there, they said, hey, Mr. Mahone, do you want the hepatitis B vaccine? And I said, yes. As a result, I have broken the cycle because I am not a susceptible host. So how do you break the cycle at this link? By having your vaccines and keeping yourself generally healthy. There's a big benefit for working in healthcare, by the way, and that is being exposed to all this stuff all the time. Your immune system is going to get stronger.
Sir, I have a question.
Yes,
Can you hear me clearly?
yes.
Okay. In reference to the shots and everything, is the school requiring us to have any of those shot records or any of the additional shots needed at the moment?
Actually, they're saying yes. That was a story on the news the other day. People were asking, why do we have to have vaccines if we're going to be staying on a virtual school? They say yes. They had a couple of reasons. I don't remember what they were, but yeah, they're still requiring vaccines to enroll in school.
So if that's the case, is the school going to provide that, or they're going to send us to a location to get those shots that are needed? Are we going to be reimbursed? How is this going to take place, and how is it going to happen?
I
Or
don't
when?
know. I don't know, but in most cities, you can get childhood vaccines for free. In most cities.
Okay.
Because they are highly recommended, and some school systems require them. Not all.
Okay.
So for people to say that your child, it's illegal for your kid to go to school without vaccines, that's not true. Each school board determines
Okay.
whether they require vaccines or not. And if they do, then they should have some resource for you to go and get them without a big expenditure out your own pocket, you know? So look around, start with the health department, San Antonio Department of Health and Human Services. And they have all types of free vaccine programs.
And also, is the school going to require to see those shot records? Because I have shot records at the time when I was working with SAMC. It's just 3.5 years I've been out in the medical field. I decided to get back. So am I going to have
You're
to
talking about for you.
everything?
Are you PCT?
Yes, sir.
Yes, you're going to need them. So either, so if you're talking about for you, yeah, either find your shot record or have the vaccines again.
Thank you.
If you've already, for example, if you've already had an MMR vaccine, measles, mumps, rubella, it's not going to hurt you to have another one now. Okay. But it is a lifelong protection, but it's not going to hurt you to have it again. And what they're going to be more concerned with is your tetanus and your hepatitis B vaccines. Vidalia, you had a question?
Well, it wasn't necessarily a question. It was a comment based on the recent conversation about vaccines and whatnot. I have 2 points of information. One, I've been homeschooling for 7, 8, 9 years almost in multiple states. That being said, I've learned that with the public school systems, it is not mandatory to require your children to be vaccinated. As you stated previously, it's based on school to school and individual regulations. I've had my children who went to public school during state to state transferred and laws that had to be put in a public school system. and they were waived for not having certain vaccines due to allergies and whatnot. So there was a way to go around it if you don't want vaccines. And also personally, we chose not to because we've had bad reactions to them. Second point, on the children doing the distance virtual learning with the public school system, I have a friend who works with the school board system in the SAISD district. She informed me yesterday during a conversation that the reason the schools are still requiring vaccinations for the students is that the school board hasn't come to a full conclusion on how much virtual distance learning is going to happen. They would like and are trying to build to where the virtual distant learning students will be coming back into campus during the winter season. They're not expecting to do virtual distance learning throughout the whole year. The ones who starting distance learning will have to return to school. They're hoping sometime after October or the winter break. And if that doesn't work out, they're still going to have to come into the classrooms to do major testing. I'm assuming it's like the STAR program that they have currently in place. So that being said, that is one of the reasons why they're still requiring vaccinations, because they do expect and would like the students to return back to campus.
Now,
That was it.
California was the first state to try and mandate childhood vaccinations, and the law didn't pass. They did it in response to that 50 cases of measles that are outbreak at Disneyland, and they tried to go statewide and make all childhood vaccines mandatory, and it was shot down. You can't make a law like that. The Supreme Court won't allow it. So there is no state in which childhood vaccines are mandatory. That comes from the individual school boards. Now, when they did the human papillomavirus vaccine, they told me that my children had to have HPV vaccine before they started school. And I said, no, they don't. And they said, yes, they do. And I said, no, they don't. And they said, we have a policy. I said, show me the policy, please. And the lady balked for a few seconds. She said, well, I'm gonna have to. I said, well, I'll wait. So I sat down on the little kiddie bench right there in the office waiting. And she finally came back about 10 minutes later with a little piece of paper. She slid it out in front of me. I looked at it. It was the schedule for childhood vaccines, recommended vaccines from the CDC. And I said, this doesn't say mandatory in here anywhere. This says recommended. And until you show me something that says mandatory, if you try to stop my kid from going to the school, I'm going to sue you for discrimination, because you're quoting a policy that doesn't exist. And that's what I mean when I say, when they say we have a policy, ask to see the damn policy. And my daughters and my son, they started the school without the vaccine. See, that's something they're going to have to decide when they're old enough to decide on their own. It's not something I'm going to push on them today, or, you know, back when they were young, because, you know, you're really not at risk for human papillomavirus until you're sexually active. And they're recommending it for 8 and 9-year-olds. Now, of course, they're going to rush out in front of you the one child in the entire United States who got cervical cancer when she was 12. Does it happen? Yes. But does it happen often enough to vaccinate everybody in the United States for it? No. It's a rare case. But of course, when they try to make their point on the commercial, they're going to push out that one person in front of you and make it seem like everybody is at this risk. But anyway, it's actually a low risk. So, and one lady at one of the meetings said, well, if your kid's not vaccinated, then that puts my child at risk. Is your child vaccinated? Yes. Then how the hell is your child at risk? You see, it's just an effort to control you, to make you do something, to make them feel powerful, if you will. They're just routing out these scare tactics that they heard from somebody else. Will it put your child at risk? Yes, it puts your child at risk if they're not vaccinated. If I want to take that risk, that's my life. Guide your own life. Don't worry about mine. Have your kid vaccinated, they won't be at risk. So anyway, So having your vaccines that are recommended for us, and then keeping yourself generally healthy. Y'all, being in healthcare is going to improve your general health. So I don't get colds. I don't get flus. I've been around this stuff my entire life. My immune system is one thing that works about me is my immune system. I've got a strong immune system. And I think I may have had COVID already. I don't know. I haven't been tested because I don't have any signs or symptoms. But that's just how strong my immune system is. I get colds and flus. I don't get sick. If I do, it's for a couple of hours or one day and I'm back to work. I never miss work for colds or flus or that type of stuff. So anyway, and even though I'm not practicing out there today, I'm still spending my entire day, not anymore, but in the classroom with 30, 40 students every day. So I'm still exposed on a regular basis. As we expose ourselves to stuff, that strengthens our immune system. Yes, Melissa.
You know what vaccine is not recommended or mandatory is the flu shot
No,
at
it's
first.
not. No, it's
And
not.
you're thinking because they told us at the school that it's mandatory because we have clinicals at the hospital, and they told us it's mandatory because it was one of the hospital's, I guess, rules or regulation. I don't know.
Yes, University Hospital. Remember what I told y'all? It's up to the organization. Now, it's not mandatory because you don't have to do an externship there. But if you're gonna do one there, you have to follow the rules of that company. And the flu shot, just go ahead and have it. I don't see any reason not to. Why were we fighting with them about the HPV vaccine? Because it was brand new. They rushed that thing through like they rushing COVID-19 vaccine now. And I'm not going to rush out to get one of them either. When they finish the vaccine, say, hey, vaccine for everybody. And be like, y'all go first. Shit. See how y'all feel a month from now. And then maybe I'll go down and have one. Okay. But the thing is, if all of y'all are vaccinated, I don't need the vaccine because y'all are vaccinated. So I'll let y'all have that thing first, and then if y'all don't grow a third eye in the middle of your forehead, then I'll go down and have one. All right. So anyway, that is the infectious cycle. I didn't put any red in here, but think about how to break these links. How do you break the link at the site at the? How do you break the reservoir link? To eliminate the reservoir. How do you break the portal of exit link? Cover the portal. How do you break the means of transmission link? Knowledge. Portal of entry? Cover. And susceptible hosts, vaccines, general health. So know how to break each one of these links if you see that on the test. How do you break the link of the cycle infection at the reservoir link? Eliminate the reservoir. Okay, now that brings us to the end of infection control. How often will y'all have infection control training in your career? Not very often at all. So the stuff we just talked about, rarely will you get it in the class again. However, the next class, the bloodborne pathogens class, when we're going to start after break, that you get every year. And as a result of that, when I'm out there in the world talking to healthcare people about infection control, they go straight to bloodborne pathogens as if that's the only risk out there. Because they have that training every year, that's what that's what their mind focuses on. So having bloodborne pathogens training every year actually does us a disservice because that's what we focus on instead of everything else we just talked about. Okay. So the flu virus, how often are you trained on that? How often do you get HIV training? Every year. Hepatitis B every year, hepatitis C every year. So when I say infection control, HIV, hepatitis B, hepatitis C. No, that's a different class. Infection control, the flu, the bacterias out there, those things that are just as dangerous as hepatitis B or C. The truth of the matter is, the hepatitis will take 30 years to kill you. HIV, up to 30 years before people are dying from that stuff. COVID-19, a couple months. So what proposes the greatest risk to us? And what training should we be having every year? All of this, not just the bloodborne pathogens part. So we'll start the bloodborne pathogens training when we come back from break. It's 9:25. We've been going almost about an hour and a half. Come back at 1:45. Give us 20 minutes. Remember, get up, get some circulation to your butt, move around, splash some water on your face. 1:45. Okay, I'm back. All right. So we will do our, I won't say that, bloodborne pathogens training now. And this is the training you get every year. Now, what that means is that somebody will come and find you or send you an email that says, you have bloodborne pathogens training on Thursday. And you'll show up there on the day at the time, you'll sit in a room, you'll watch this little 30-minute video, you'll sign your name, and then you'll go back to work. Okay. So unfortunately, that's how most people do their bloodborne pathogens training. They just get a pre-made video out there about 30 minutes and run that for you. It doesn't go as deeply as it should. Now, I was thinking about this on break that you think healthcare people are paying attention to infection control today. And as a result, that might be mandated from now on. I can see somebody putting forth legislation that healthcare be educated in infection control annually, along with their bloodborne pathogens training, because we see it is not HIV that's having us stay at home. It is not hepatitis B that's got the schools closed. None of the bloodborne pathogens are even being talked about right now. It's all about infection control right now. In the 80s, what was it all about? HIV. You're gonna get the HIV. You better do this, better do that. So folks said, well, maybe we should do some annual training on that. And that's where the bloodborne pathogens training came from. All right. So bloodborne pathogens, those, remember what a pathogen is? A microorganism capable of causing disease. Remember, patho means disease. Take this out of here. I don't want to delete, I want to cut. Just cut it. All right. Remember, pathogen or patho means disease. So these are the disease-causing microorganisms that live in the blood. So they're spread through the blood. All right. Bloodborne pathogens training, as I've mentioned a couple times already, annual training, trying to get me Kleenex, annual training that's mandated by, let me turn this off. I hate autosave. I can remember to save something if I wanted to. All right. So anyway, bloodborne pathogens training is mandated by a government agency out there that has the power to pass administrative laws. And the organization is known as the Occupational Safety and Health Administration. That's in red because I already told you that if there's an acronym in my presentation, you will see it on your test. And there's your second acronym, OSHA. And all these lenses are scratched, doggone it. Oh man. Hate it when that happens. All right, so anyway, the Occupational Safety and Health Administration. Now, when we think about this, we think strictly healthcare, but OSHA is a national agency concerned with all workplace, not just healthcare. OSHA actually started in the construction industry, looking at the safe practices that need to be put in place to protect construction workers. And this picture I put on the slide because this is the picture that caused the OSHA legislation. A seated senator saw this picture on the cover of Time Life magazine, and the name of the article was The Growth of a Nation. You can't really see it real well, but in the background is Central Park. And down here below them are other skyscrapers. So how high are these dudes up in the air? And what is it about this picture that made somebody say, wait a minute, that's not right? What's not right about this picture? however many feet these guys are off the ground, they're not tethered in at all. If one of them falls, that's it. See, there was no workman's comp back then. They'll just find somebody down on the ground pushing a wheelbarrow for $3 an hour and say, hey, you want to work up there for $10 an hour? Yep. So no benefits to the family or to the worker or anything like that. So they proposed a bill that would mandate employers to provide appropriate safety equipment for their employees, regardless of what job they're doing. So if they're working up off the ground, I think today you have to be tethered in if you work more than 8 feet off the ground or something like that. Okay? And that's the result of OSHA legislation. Now in healthcare, OSHA decided to focus on two things. And OSHA was as part of healthcare, but not a major part until the 1980s, when OSHA said that you've got to start protecting your healthcare workers from this HIV thing that's going around, hence bloodborne pathogens now. So my OSHA mandates two guidelines for us in healthcare. One of them you already know. It's called Universal Standards. And I should actually change the order of these two words. Is Universal Standards, that's also known as Universal Precautions. Standards is the main term today. Remember, Universal Precautions is an old school term. All right, so there are two safety guidelines mandated by OSHA. Another high missed question on the test. They are Universal Standards and the Bloodborne Pathogen Standard. I want another dot right there. Oh, I'll move your ass over. All right. So Universal Standards, also known as Universal Precautions. I'll just type it again. That gets on my damn nerve. I'm OCD about that kind of stuff. Or I'm obsessive about that kind of stuff. It did it anyway. Piece of junk. Anyway, I'll leave it like that. I don't care. I do care, but I'll just leave it. So anyway, Universal Standards and the Bloodborne Pathogen Standard. You already know Universal Standards to treat all persons and body fluids as if they are infectious. So know the two guidelines mandated by OSHA, Universal Standards and the Bloodborne Pathogen Standard. All right, we've already done Universal Standards to treat all persons and body fluids as if they are infectious, and it's like that again. You know, Universal Standards, also known as Universal Precautions. And it's going to jack it all up again too now. See? Yeah. Forget it. Forget it. That's what I get. All right. So, and we know the definition to treat all persons and body fluids as if they are infectious. Do it that way. Shouldn't be there. That was me talking to somebody last class, last time I taught this. All right. So that's Universal Standards to treat all persons and body fluids as if they are infectious. Take these check marks off of here. And what do we mean by body fluids? This is a list of body fluids that come out of us that are wet, that are known to carry some microorganisms. Not all of them carry bloodborne microorganisms, but they do carry some. For example, blood and semen, vaginal secretions, we know all carry HIV, but urine does not. It does carry other microorganisms, but not the bloodborne stuff. Okay, saliva, a condition that's carried through saliva, we've already mentioned one was called the mononucleosis, but also rabies can be transmitted through saliva. And though mono doesn't kill, rabies can. That's why animal bites are reported to the CDC. We had a whole procedure just for that. If you came into the emergency room, you were bit by a dog, we had all the forms we had to fill out to send to the CDC to prove that, have that dog checked for rabies. It can be lethal. However, it's also one of those things that you can be treated for after exposure. So if you are bitten by a dog or a raccoon or something like that, and we are not sure whether the animal had rabies or not, there's no way to find the animal and check it, then we will start you on the rabies vaccine. And it will protect you even after you've been exposed, which is a good argument to stop giving, why we don't give it to everybody. Okay, this is one of those things you can be vaccinated afterwards. Breast milk is known to transmit HIV and hepatitis B. Pleural fluid, that's the fluid around your lungs. And we know that fluid carries COVID-19. Feces. Feces are most commonly what we're going to find in feces or in the digestive tract are going to be parasites. So one of the most common tests for a parasite would be an ova and parasite, or an O and P test. My owner's gone and do an O and P on them to see if they have parasites inside them. And that is the most one of the most common tests for feces. Tears are known to carry the infection of conjunctivitis. And when you have conjunctivitis, it makes your eyes weep, and therefore you rub your face, and then you go back to using the keyboard. Conjunctivitis, also known as pink eye. There are two things that shouldn't be tolerated at daycare. I mentioned one of them yesterday, it was biting. The other thing that they should not tolerate is red eyes. You got to go home if your eyes are red. I'm sorry. Conjunctivitis is highly contagious in the first 72 hours of the infection because people touch our face, because we touch our face so much. Okay. So conjunctivitis is spread through tears. Sweat. Now, this is the one major exception here. There have been no major microorganisms associated with sweat, but we do want to just be cautious. Okay. Because dirt and oils and things like that are passed through sweat as well. Now, back when, I don't know if y'all are old enough to remember, when Michael Jordan went on TV, or not Michael Jordan, but Magic Johnson went on TV and announced his HIV status to the world, told everybody he was HIV positive. Now, what you might not know is that was not a retirement announcement. Man wasn't saying he was quitting. He was just saying he was HIV positive. And other players started a petition stating that he should not be allowed to play in the NBA. And that's one of the reasons, one of the drawbacks of putting your business out there like that. Other people are going to get in there real quick. So they got in the man's business and said he should not be able to play basketball. And they stated the reason as there's a lot of sweating that happens on the basketball court. Okay, so let me ask y'all, would you play basketball with Magic Johnson, knowing he's HIV positive? No, I see some no's. Nobody would play with Magic. Okay. I would, but not in the NBA. Not down there on that court playing for what's at stake is billions of dollars. No. You want to shoot some hoops in the backyard? Okay. Because HIV is not transmitted through sweat. But if you're down there and you're going for it and elbows are flying and people going up for rebounds and all that, there's a good chance somebody gets cut. And they get cut on the basketball court a lot. Nails, elbows, and so on. Even if you're wearing those little goggles or glasses, somebody hits the edge and boom, that frame cuts into you. So no, I wouldn't play with Magic Johnson, not for millions of dollars. And it's not because of sweat, they had the wrong idea. It's because of the blood that could happen. And yeah, there are other players who might be HIV positive that we don't know about, but this is a risk that I do know about. And why take a risk that you know exists? It's like the idiot who won't wear gloves. Why would you not wear gloves when you know the risk exists? I don't care what your skills are. Okay, now I usually stop here and mention something briefly. It's off the topic, but it is about healthcare. Why do you think famous people sometimes just come out like that? Like Michael Jackson, like Magic Johnson did, or Charlie Sheen, who just out of the blue announced, I'm HIV positive. Why do you think they do that, famous people? Just put their business out there like that. Because you know people gonna get in their business. Magic Johnson, we don't want to play with you. Charlie Sheen, is it safe on the set to film the TV show? What happens if he cuts himself? People don't get in your business. So why do you think they put their business out there like that? What do y'all think? Is anybody out there?
Due to the fact maybe they have many sexual contacts with other people, or they're pressured by their publicist, or the physician had suggested, hey, for the safety of others, et cetera, et cetera.
So you think they're being socially responsible? It's just like,
correct.
That just let people know, to protect other people. No.
For lawsuit or awareness?
No.
Awareness? No.
Lawsuits?
Probably not. Nobody probably knows they're infected. No. You know why they put their business out there like that? Because somebody was getting ready to out them. Somebody was getting ready to tell on them. And their publicist told them, if you come out first, then one, they don't get the money that whoever they were selling the information to. And two, you seem more socially responsible if it comes from you rather than another source. So their publicist told them, yeah, you need to just go on and announce it, to deny them whatever money they were going to be paid. I mean, imagine if you knew today that, what's his name? Patrick Mahomes, who just got the $500 million contract. What if you knew that he had bad knees and was going to need knee surgery in the next year or so? And you're the only one who knows that. How much money would that be worth? To the newspapers, to the tabloids, to the Las Vegas betting people. How much money would that be worth? You could get millions of dollars for something like that. So think about Magic Johnson at the height of his career, and you're the only one who knows he's HIV positive. How much money is that worth? Somebody's going to sell him out. And it could have been, and how does this relate to healthcare? Because it could have been a healthcare worker. The man was diagnosed someplace. Somebody ran the lab. Somebody saw him coming in for an appointment to the doctor's office. and looked up on the computer what he was there for. Some healthcare people had that information. And what would that information be worth out there? Would you lose your job? Yes. Hell, you could even go to school, go to jail today. But how many of y'all would go to jail for 2 years for $5 million? Yeah. 2 years out of my life. So you're going to pay me $2.5 million to stay in jail for 2 years? Yep. I'll go. Come out there with my $5 million. So yeah, there'll be some consequences, but the benefit could outweigh the consequences. Like Colin Kaepernick, when he wore the Beats headphones on the sideline, he knew damn well he was going to be fined for that. Bose is the official headlines of the headphones of the NFL. You sit down there with Beats headphones on your head, yeah, you're going to be fined for that. And they fined him $50,000. But guess how much Beats paid him to wear those headphones? $250,000, $300,000. Yeah, I'll pay a $50,000 fine. So the consequences or the benefit may outweigh the consequences. I think somebody's going to tell them both of them. And it could have.
As healthcare providers, technicians, whatever our positions are in the medical field, do we not have an oath or a right to not invade their privacy? It is not our choice and decision to go out there and say anything. Isn't that in violation of, of their privacy? Let them make that choice and decision whether we, found out by a test or et cetera. Isn't that, violating the code ethic of?
Well, it's not only it not only violates ethics, but it violates the law. So yeah, we have an ethical responsibility, yes, but we also have the legal responsibility now. See, back in the day, HIPAA was not illegal to violate. It wasn't illegal to violate a patient's confidentiality like that. It was an ethical issue. Today, it's illegal. So yeah, they're going to go to jail. But like I said,
Okay.
$1 million, pretty tempting. Pretty tempting.
I guess you have to be a very humble person then.
And now think about this. Could Michael Jackson or Michael whoever sue them? Sure. But again, if you're talking to the tabloids out there, they may be tempting you with $10 million. So a person might go on and take the chance. That's a pretty tempting offer right there. And they may just go on and take the chance or try to release it confidentially so that nobody knows it's you who released the information. Will your job fire you? Yeah. And they probably won't even file charges. Who wants to be the clinic that's associated with releasing Michael or Magic Johnson's medical information? Nobody. They're going to try to cover that shit up. You don't want your name, your clinic name associated with that. So they're not going to punish you. They're going to fire you. They're going to see that your license is revoked. But who cares if you're a millionaire? So it's all a game. Can you pay me enough money? It's like Colin Kaepernick. Wear our headphones on the sideline. They're going to give me a $50,000 fine. Okay, we'll pay the fine plus pay you $150,000. Oh, hell yeah, I'll do that for a slap on the wrist, sure. So sweat. The other fluids are cerebrospinal fluid. That's the fluid around your brain and spinal cord. In that fluid, we're going to find conditions like meningitis. The thing we do the spinal tap for. Get into your spinal column and take out some of that fluid, test it for meningitis. And meningitis can be lethal. It can kill you. Pericardial fluid is the fluid around your heart. Oftentimes people will have a condition called pericarditis, inflammation or infection around their heart in that fluid. Amniotic fluid is the fluid that the baby floats in the womb, and then peritoneal fluid is the fluid of the abdomen. All been known to show some infectious diseases pass through them. All right, so those are examples of potentially infectious body fluids. But this list isn't all encompassing. For example, the fluid of the eye is not listed here. And basic tissue fluid is not listed here. The fluid that we call lymph, the fluid that flows through our lymphatic system, is not listed here. So if there's something that is not listed, but it's wet, then it falls under this category. OPEM. And there's your third acronym. PPE, OSHA, and OPEM. Other potentially infectious materials. Practice your spelling of potentially. Other potentially infectious materials. The stuff that comes out of our body that was not in that previous list. Like what this dude is coughing up right now. It's called sputum. You cough it up from your lungs. Wasn't listed. Sputum. And you PCTs might get involved in collecting sputum samples from a patient. Having them cough that stuff up for you. Putting that in a tube, sending it down to the lab. So other potentially infectious materials, OPEM. And I stopped right here last module, last time I taught this, to just give you one sheet that shows all 4 acronyms. So you see them all in one place. OSHA, PPE, OPEM, and ECP. ECP will be covered a little bit later. But this is just one point where I just was a good place to stop and put them all up there. So my wife announced that she's going on vacation too. I'm going up to see my sister. I say, fine, go see your sister. I don't care. Shoot. I'm still doing my thing. I'm just gonna go see my sister then, because leave me here by myself, like by yourself, whatever. So anyway, she just got to do something just because I'm doing something. Go up see her sister, whatever, and then gonna try to follow me to Dallas. Well, we just follow you to Dallas, and then you go, and then we'll go. No, don't be following me. You just want to keep your eye on me. Think you slick. Anyway, because she know me, she know how I am, how I be. It doesn't help that my best friend has 6 baby mamas, y'all. And be like your little friends out there. I can't imagine. I look at them like, dude, you must be crazy, man. All them baby mamas out there asking for, she need to have her hair done, and he needs shoes for school, and please. Makes me think about Abraham. Abraham supposedly had 900 kids, y'all. That's Abraham from the Bible. Supposedly had 900 kids. Can you imagine the child support? Damn, dude. Anyway, so those are your 4 acronyms: OSHA, OPEM, PPE, and ECP. We'll be talking about here in a little bit. All right, now here is the standard itself, the bloodborne pathogen standard, and what it actually says. Employers must provide reasonable protection for all employees who have potential for exposure to bloodborne pathogens. That's the standard. And I want to call your attention to this word, reasonable. Now, what is reasonable? If I ask you or tell you I need you to go down to room 3 and draw some blood for me, and you say you're not going to do it without a BSL-4 lab suit, remember the one with the hood and the hose attached and all that, the 2 people standing in the room, then that's not reasonable. Okay? You're being unreasonable. That's way overboard. And to think that people won't do that, back in the 1980s, there was a guy who got in an automobile accident in San Francisco. And when the police showed up, he had a cut on his arm. And he was trying to be socially responsible and tell the policeman, you know, please be careful. I have a cut right here. It's bleeding and I'm HIV positive. The police called out the hazmat unit. Yeah, The people that come out and clean up chemical spills and shit. Yeah, called the hazmat unit because the guy's arm was bleeding. So it's not a stretch to think that people out there would be unreasonable and be asking for things that just are not cost effective. If you are a diligent person and you have good technique, you should be able to draw blood with a pair of gloves and goggles at the very least, or at the very most, in order to draw blood from somebody. All right, so keep in mind that word reasonable. However, the employer does not have a choice. They have to provide you with appropriate PPE. They must. They can't tell you we ran out. They can't tell you you have to wash your mask and rewear it. That's bullshit. And that's what's going on in some of those places out there today. Telling nurses and technicians to wash the mask and reuse it. No. Now, if there's a overall mask shortage, then we have to do what we have to do. But in normal situation, no, they can't do that. Anybody have latex sensitivity to gloves? Your hands get sensitive if you put latex gloves on. Then the employer must provide you non-latex gloves. They can't make you go out and provide those for yourself. Now, what I did, and why would they do that? Because non-latex gloves cost twice as much as latex. So the employer is going to incur a little cost by providing non-latex gloves for you. So and they're purple and green, and people think they look cool, so they'll go and grab those rather than grab the latex gloves, which are the cheaper ones. So what I did back then was I would issue a box to you and tell you when you run out, come back and I'll give you another box. But I'm not going to leave these things sitting out on the counter for anybody to use because they're just too expensive. So I would provide them for you. And then when you need more, you come back to me, I'll give you another box of them. Instead of setting them out there for everybody because they are expensive. But I have no choice. I have to provide the gloves for you. Or have you not do procedures here. All right, so that is the standard right there. Reasonable protection. And how do we keep from getting in trouble here with this word reasonable? We have experts and we go through and we look at every procedure that you do and we take the advice of the experts. For example, Mr. Mahone, when your people draw blood, you should be providing them with gloves, goggles, face shield if they think necessary. Okay, and I go with what the experts say. So do they need like shoe covers when they're drawing blood? Not unless their technique is just that damn poor. They're dripping blood on the floor. So it would not be reasonable to provide shoe covers or to list shoe covers as the PPE for drawing blood. All right. So there's the key, the reasonable protection. And we do not have a choice. We must provide that PPE for you. If we don't, then we're in a violation of OSHA. And do you know what the fine is for OSHA violations? Anybody? And you might know, other people might know because they are also at Home Depot and other places for the workers. Any place people work, they should have that OSHA bulletin board in the break room.
I used to own, I'm sorry, I didn't mean to interrupt, but I owned a cell phone tower company. And OSHA's, like you said, with construction, that's where it started. And we built cell phone towers all over the world. So I know my fine with my tower climbers was $500,000 minimum. And I had to put down $1.5 million just to acquire insurance that was OSHA approved.
Yeah. If they walk into your clinic, $10,000 a day until you get it corrected. That's no joke, y'all. So if you're out there causing OSHA violations for your employer, because you don't know, they hire you as a new manager, how easy is it? Now, this example isn't OSHA, it's another organization that would get involved in this, but this is how easy it is. I was standing in the Subway restaurant and waiting to order a sandwich. One lady was at the cash register, but there's another guy who came out the back door, or a little back office area back there. And he came out, he started talking to the cashier. And she said, well, how did it go? And he said, well, it went okay, but this guy has scoliosis, which means he'll probably have a lot of medical appointments. So I don't think I'm going to hire him. This guy has no idea how many laws he just broke. Suable offenses that somebody could sue Subway for. And he had no idea. He's just talking, restaurant full of people. There were 3 or 4 people in line behind me. Yeah, you guys has scoliosis, so I'm not going to hire him. You just broke the law. So that's how easy it is to not know something. And how many people out there don't know their OSHA regulations? It'd be real easy to get your company sued if you don't. All right, so that is the bloodborne pathogen standard text, what it says. All right, employees are required to provide appropriate PPE. There it is again, and the list again. The second category of protective equipment are referred to as engineered controls. This is something that the employer gives you to protect you from these bloodborne pathogens. You go out and you buy it. It was made for you, engineered, something that was made for you to go out there and use. And good examples of those are Sharps containers, this little red box right there. Biohazard trash cans, the big box. Eye wash stations, safety needles. We'll see examples of safety needles here in a minute. But these are things that the employer buys, puts out there for you to use to protect yourself. Now, what is a Sharps container? As the name implies, it's a container where you put all the things that are sharp, like needles, scalpel blades, anything that could stick or cut somebody goes into this container. It's puncture proof, so nothing's going to poke through this thing. This is hard plastic, so nothing's going to poke through it. Once it's full, you seal it, and nobody ever opens it again, and it goes off to be destroyed. So one actually HIPAA violation or OSHA violation would be to put regular trash in your Sharps container. Because if they see that, they're going to assume that the people that work here don't know what a Sharps container is for. If you're putting gauze, the wrapping from the needle that you opened, the paper wrapping, if you're dropping that in a Sharps container, the people from OSHA are going to assume that you don't know what a Sharps container is used for. And we'll start that $10,000 a day fine. Now, the other container is the biohazard trash can. You can call it a box. Some people call it trash can. It's just semantics. You'll hear me refer to it as simply biohazard trash. Now, in this box, you're going to put everything, and it says may contain Sharps, because when this is full, the Sharps container is full, you drop it in this box. And that's what they mean when they say it may contain Sharps. But in here, you're going to put everything that is contaminated. For example, bloody gauze, gloves that got blood on them while you're doing the procedure. That stuff will all be disposed of in the biohazard trash. Now, these boxes are brought to you by the contractor that you contract with to pick them up and destroy them. So when you get a full box or 3 or 4 full boxes, you call the contractor, they come over, they pick it up, and they leave you new boxes. And there's a red trash bag inside there that makes this kind of waterproof. They'll leave the boxes in the bags, and then they'll come back and pick them up as you fill them. Now, there is some debate out there in the world over what goes in biohazard trash. Okay. How many of y'all had your blood drawn before? Okay. When they finish drawing your blood, they put that little piece of gauze right there. When you took that off, there was a red drop in the middle of it. Where does that get thrown away at? Does it go in biohazard trash or does it go in regular trash?
Biohazard.
Biohazard. Okay. Now, go back to the description I gave you of infectious fluids. They were liquids. That drop in the middle of that gauze pad, is it wet? No, it's dry. Remember what I said? If it's wet and it comes out of a person's body, it goes in the biohazard trash. Why they made such a big deal about that 2x2, that gauze pad. Here at the school, we fill up about 6 of these a month. No big deal. They cost about $30 to dispose of. The contractor pays you, charges you $30 a box to pick this stuff up. No big deal for us. Go to Santa Rosa, University Hospital, SAMC, those big hospitals. How many of these boxes you think they get rid of every month? It's in the millions of dollars. So they started looking at it from a money perspective. And if that gauze pad with that drop in the middle, if that drop is not wet, they tell you to put it in the regular trash can. They did some study, I think it was at University Hospital, that said it cost them like $1.5 million a year just to throw away these gauze pads. Now here at the school, we have a little different perspective on that. If it's red, it goes in the biohazard trash. I don't care whether it's wet or dry, it doesn't matter. It goes in the biohazard trash because we're not in the money part of it. But when the money people start getting involved, they're going to start coming up with little caveats like that. If it's dry, put it in regular trash. And obviously OSHA has no problem with that because the place is still open and they're still doing business. So OSHA knows what they're doing and they don't have a problem with it. But here at the school, anything red, anything that comes out of a person's body, wet or dry, goes in the biohazard trash. And that's a good test question for you. Bloody gauze or contaminated materials like a bloody gauze should be disposed of in biohazard trash. When we teach here in the building, we usually walk down to the lab and I show you all these things down there. Unfortunately, can't do that right. I guess I could get a camera and walk down there. I'm not going to do that. Sorry, I'm too lazy. All right, so that is a good test item for you. Contaminated materials such as bloody gauze should be disposed of in the biohazard trash. And since this little container, the Sharps container, also is biohazard, all the needles get put in there, and then the box, when it's full, gets put into the biohazard trash box. You just seal this and drop it in there. All right, so those are examples of engineered controls, something that is made for you, purchased for you, and put out for you to use. Other examples are the eye wash stations. See the ones that are mounted to the sink, and also the ones that mount on the wall. Here at the clinic or here at the school, we use this type. It's mounted on the wall down there in the lab, in case something splashes in your eyes. A safety needle is a needle that has a safety cap attached to it. When you're drawing blood or giving an injection, this cap is folded back out of the way, like this. And when you finish your procedure, you use your thumb just like that to snap that up over the needle. It completely covers the needle. It snaps on so that once it's clicked on, you can't take it back off again. And it makes that needle safe. It completely covers the needle cap once it's snapped in place. And you can't undo that. Now, these are the type of safety needles we use here at the school. But there's a problem with these. When you draw blood at the school, you're going to have a sharps container within an arm's reach of you. That's our rule. That way, when you take the needle out of the person's arm, you drop it in the sharps container just like that, and you're done with it. So the sharps container is sitting right there next to you. You do your procedure, take the needle out, drop it in the sharps container. We don't engage the safety cap. No, not necessary. It's going right in the sharps container. Why do we do that? Because sometimes when you're drawing blood from somebody, when you take the needle out their arm, there'll be blood in this hub and all the way in the length of the needle. We talked about that yesterday. This needle will be filled with blood, not just the syringe, but the needle itself. And sometimes you have a little blood drop on the tip of that needle. And what's going to happen when you snap this cap over that? I'm going to flick that blood drop off there. So it's just one more chance to contaminate somebody. If that lands in a person's eye, and I'm not talking about you, what if you take it out, snap the cap on there, it flies in the patient's eye? Or in a coworker. So that's why here at the school, as soon as you take the needle out the arm, you drop it in the sharps container. You don't worry about engaging that safety or that cap, that cover right there. All right, so all of those are engineered controls, something that was made and given to you to use. Now, the second part of this is going to be what we call work practice controls. What if we put out sharps containers but didn't tell you what they were for? Or we didn't have policies like the sharps container needs to be within one arm's reach of you when doing the procedure. That's a work practice control. That's something you do to protect yourself. This other stuff was given to you. But to say every time I draw blood, I'm going to have a sharps container right there next to me, that's a work practice. And that's another way you protect yourself, work practice control. That's what you're taught when you're hired at a place. That's what you're going to learn down in your lab classes. Now, what good would it be if I took a sharps container as a manager of the clinic, I took the sharps container and I mounted it on the wall in a room? And what does that lock you to now? You can only draw blood in that spot because you have to be within one arm's reach. So mounting them on the wall is not the best practice. Even though I know y'all been in doctor's offices and y'all seen those little sharps containers mounted on the wall in there. It's not a good practice. They should be movable, transportable, where you can move them to where you need them to be. All right, so that's a work practice. If you're drawing blood here and your sharps container is mounted on the wall over there, that's poor work practice. Something that you're doing that is putting you at risk. You have to you or somebody else, you have to walk all the way across the room with this contaminated needle before you can throw it away. So that's work practice. Your hand washing practices, your annual bloodborne pathogens training. Don't recap needles if you can avoid it. And when you do have to recap a needle, use a one-handed capping technique. And that's what this is right here. You lay the needle cap down on the surface and you slide the needle into the cap rather than holding it with your hand like this. Most needle sticks are probably going to happen in the side of the finger or in the thumb for people. Oh, I just stuck myself. Yeah, you should have used the one-handed capping technique. So, and you will learn that in your lab classes. Now, where would be an instance where we would have to recap a needle? Let me tell you how it should work when you're drawing blood. The patient is seated or seated in front of you. You're standing. Always stand when you draw blood. You're standing, patient seated in front of you. You have your needle. You're ready to draw blood. Uncap the needle, draw the blood, drop the needle right in the Sharps container. You should never have to recap that thing. An instance where you would have to recap a needle, it comes from the idea that we don't draw up medications in front of the patient. So if you have to give somebody a shot, you're going to go down to the medication room and draw that up. But you have to recap the needle to get back to the patient. And this is how you'll do it. You'll draw up your medication. You'll set the needle cap down. You'll scoop it up, snap the cap on, and then go down and give your patient a shot. After giving the shot, it goes right in the Sharps container. So you don't have to recap it again. So when you do have to recap a needle, using one-handed needle capping techniques. Wow, man, what is going on? I see some folks are y'all in the scenario where your phone kicks out after 40 minutes? If you're on the phone or something like that, because I see people are leaving and coming back and leaving and coming back. If your computer is kicking you out or your phone is kicking you out, you need to go into that area in the settings and where it says when to turn off the phone, click never. Otherwise, it may cut off and kick you out of the meeting. Same with your computers. Some computers, when the screensaver comes up, it kicks you out of the meeting. So you need to put those settings to never. Don't turn it off. I'll turn it off when I want to turn it off. So turn off that automatic turn off your phone or computer thing, and it won't kick you out of class. All right, so those are work practice controls. Be able to pick out examples of those. In other words, I won't ask you to list them, but you might be asked, for example, Sharps containers and eye wash stations are examples of engineered controls. Hand washing and not recapping needles are examples of work practice controls. And we already mentioned the bloody gauze. Contaminated materials like bloody gauze would be disposed of in your biohazard trash. Now, this is how we mark things that contain biohazard. The Sharps containers, the biohazard box, you see it right there, all will have this symbol on there. The bag that you use to transport a lab sample down from the ward down to a lab will also have the mark on there, the biohazard symbol. And I'm going to caution y'all, because that symbol right there is also in the tattoo books, the tattoo parlors. So if you're flipping through trying to find a cool tattoo, don't stop at this one. It doesn't say the word biohazard there, of course, but it has that symbol. And yeah, a young lady did have this symbol on the back of her neck, exact same symbol. And of course, she made the decision to go into healthcare. So I'm walking down the steps over at College of Healthcare Professions. She's in front of me. Everybody's going out on break. She's walking down the steps in front of me. You just see the biohazard right there. I'm like, oh, really? What are you saying? Hey, I'm a biohazard. Caution, caution. So it is in the tattoo books. So just know that that's not the one you want to choose if you're going to be working in healthcare anyway. All right. So anyway, that is your biohazard. It's usually on a red, orange label, but you see, not always. The symbol with the appropriate terms underneath. So it's not always red, but most times it is. All right, so that's your biohazard marking. Everything must be appropriately marked. Now, the other thing that the employer needs to do to be up on HIPAA, or excuse me, OSHA, is to maintain an exposure control plan. And that's your fourth acronym right there, your ECP, your exposure control plan. What is that? It's a plan to control exposure. Exposure control plan. Okay, and know this statement right here. The document that outlines procedures for employees to follow when they have an exposure incident at work. An exposure incident is a needle stick or a blood splash or anything that's caused you to become exposed to a biohazard at work. This is the document that tells you what to do about it. Some things that would be contained in here or need to be contained in here is, first of all, we're going to list in this document, and it's usually just a binder kept in the boss's office somewhere or somewhere in the workplace, a little binder with information about our exposure control plan. And first, we're going to list everybody that works here, not by name, but by job. We have doctors, we have nurses, we have CNAs, we have medical assistants, everybody that works here. What procedures they do that put them at risk. Doctors might do suturing. Nurses might do feeding patients plus IVs. CNA, feeding patients. You could always be bit. Hey, anybody ever been bit by a patient? Bit the shit out of me, man, right here on my arm. Young lady been in an automobile accident, and we're out there trying to calm her ass down, and she is just like, da, 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 da. And she took a chunk out. She didn't take a chunk out, but man, she left teeth marks. That shit hurt. So feeding a patient, giving injections, drawing blood, every procedure that each one of these disciplines does that puts them at risk. And then the PPE that we require for that procedure. So for doctors who are doing suturing, we recommend gloves, gown, and possibly face shields. If you're starting IVs, we recommend gloves, goggles, or face shield. So every discipline, what procedures they do. So this would be listed down as suturing, minor surgery, pelvic exams for doctors, everything that they do. And then the PPE that's recommended for each one of those procedures. So that's the first part. Who works here, what they do, and what PPE we recommend for those procedures. Secondly, we're going to list everybody's hepatitis B vaccination status. Because as part of OSHA, employers are required to offer you the hepatitis B vaccine, the Hep B vaccine. And proof that we offered that to you and that we paid for it. If you decline this, then we're going to have a statement in here under your name. It was your declination statement. You declined the hepatitis B vaccine. But we have to have that listed in there that we did offer it to everybody. Anybody who doesn't want it, we're going to have to sign a form saying, yes, I was offered this and I turned it down. We're also going to have instructions for anybody who does have an exposure. For example, you get a needle stick on your finger. What do you do about that? The guidelines are outlined in this document. First thing, and everybody should know this by the time you're out there working, the first thing you're going to do is wash the spot. So you stick yourself, oh man, wash your hands. Wash the spot where you stuck yourself. Then go to your manager. And in there, it'll tell you what clinic to go to. You want to see a doctor? All right, you can go to this clinic and be seen under the company's insurance because it was a work injury. You could also go to your own clinic and have them bill the company's insurance. In my ECP, I always had business cards that had the insurance account number and the number to call to have it confirmed. So all you have to do is take one of those cards out, put it in your pocket, go down, see the doctor, give that to the doctor. Or when they ask you, how are you paying for this? Boom, give them that card. They'll call and confirm it, and they'll charge you under that insurance. All right, there'll also be an incident report in here for you to fill out, telling what happened. And probably the most important part of that incident report is the section that says, how are you going to keep this from happening again? And that part is filled out by the manager. That's why managers don't like to see this kind of shit. Oh, the needle stick. Oh, damn. Now I have to write a 2-page report of how I'm going to keep that from happening in my clinic again. Okay. Now, I did a couple of OSHA inspections in my career. And I remember 2 write-ups for exposure control plans. One place I went in on the night shift into an emergency room, and I introduced myself, and I asked a young lady that was on duty to show me the exposure control plan. I need to see y'all's exposure control plan. Oh, yes, sir, no problem. We went down the hallway, went to the boss's office. It's right in here. She tried the doorknob, the door was locked. I said, do you have a key to this room? No, sir, we don't. That's the boss's office. All right, that's a write-up. This thing needs to be available for everybody during all times. The second write-up was about the content. I went into ECP, no problem. They handed it to me, no problem. I'm going through it. And it says right there in the ECP that if you have an exposure incident, you need to report to Human Resources between the hours of 8:30 and time. I said, no. If there's something they need to do, it needs to be in this document, because we don't always just have finger sticks or incidents between 8:30 and whatever time. The form they needs to be, and it says you need to go to Human Resources and fill out form number 1077. You can get this form between the hours of No, that wasn't right. So what they were facing then was a $10,000 a day fine until they got their ECPs corrected. Neither one of them were actually fined, because what they did was they corrected the issue before the final report for the inspection. If they do that, they're good to go. So they just had to come back and show me what they had done to correct that before we finished typing the final report. So that is your exposure control plan and what it is. All right. So those are all 4 of your acronyms. Make sure you remember those and the other definitions that I gave you. The rest of this presentation will not have a whole lot of questions. There are a couple, like right in here. Yeah. Okay. But what we're going to be talking about for the rest of this class are the 3 things, the 3 conditions out there that OSHA has identified as high risk for healthcare workers. And real soon, I think OSHA is going to kick in with infection control as well. You see, right now, it's just all about the bloodborne. That's why we call it bloodborne pathogen strain. Eventually, I think OSHA is going to kick in to infection control and get on board with the rest of the world, or the rest of us in healthcare. All right. Before we go into this, I do want to mention that I mentioned it briefly. You will have your OSHA inspections. And if anybody who's worked out there in the world may have been involved in one of these. Boss walks out there, oh, OSHA's coming tomorrow. Oh man, everybody's panicking. Yeah, who wants one of those $10,000 a day fines? OSHA can also lock your damn doors. In which case, nobody comes to work until you get this shit straightened out. So OSHA inspection is a big deal. And in the couple of OSHA inspections that I've done, there was nothing shut down, but a couple people did get fines, or a couple areas did get fines. How do you become, anybody think you might want to be an inspector? How do you do that? You sign up. See, these people don't work for OSHA. They are other emergency room managers. OSHA gives them a checklist. They come down to your emergency room and they inspect your emergency room. I did one in Florida and one in Enid, Oklahoma. So once you sign up, you have to be, you know, not an expert in your field, but knowledgeable in your field. I had enough experience. I'd been around emergency rooms enough times, for enough time. I went on and signed up, and they'll call you. Hey, Sergeant Mahone, how you doing? Hey, yeah, listen, we got an inspection going on down in Florida in September. Are you good for that one? Hell yeah. Goes to Florida for a couple weeks. And then I ended up in Enid, Oklahoma, because he said, and this is the guy who organized everything. He said, all right, I'm home. I gave you Florida. You got to do Oklahoma for me. Damn, really? So I ended up going to Enid, Oklahoma, which is like, anyway. So now, why people typically fail their OSHA inspections in healthcare? Because of something stupid like the ECP, but it's usually something they can fix right away. But why do they fail? Because when somebody says, we're going to have OSHA inspection next week, oh man, they get out the ECPs and they start walking around talking to everybody. What are you going to do if you get a needle stick? And making sure that their folks are well up on this stuff. But they forget that OSHA inspects everything, not just bloodborne pathogens. They're going to check your lights, your fire extinguishers, your exit signs, and all that stuff they forget about. They jump right on there. We got to get our ECP squared away. We got to make sure everybody knows how to answer the questions. The questions are things like, yeah, how you doing? Yeah, listen, what would you do if you had a patient fall in here? See, it's not about the patient falling. It's about you and safely getting that patient up back onto the exam table. So safe lifting practices. So they walk around and question people. So they try to get okay, now make sure y'all say this, make sure y'all know where this is. And they forget all about the fire extinguishers, the exit signs, and those type of things. And that's where they end up failing. So that is the OSHA type inspections out there. And you can be an OSHA inspector just by volunteering. Well, you got to have the expertise as well. Got to be around for a while. All right, so the top 3 bloodborne pathogens, the things that OSHA has identified as those things that you are most likely to encounter in your career or in your normal everyday practice. Starting with hepatitis B. Now, hepatitis B hepatitis means inflammation of the liver. Hepato means liver. And itis is inflammation or infection. I have that over here, don't I? Yeah. Hepatoliveritis infection or inflamed. So that's what hepatitis means. Infection of the liver. It's infected by, there are 6 hepatitises. A, B, C, D, E, and G. Why they skipped F? Probably because it just doesn't sound good to have hepatitis F. I don't know, but anyway, they skipped F and went to G. But the 2 that are bloodborne are B and C. Hepatitis A is food and waterborne. D, you only get if you had B before. And E and G are also food and waterborne. So B and C are the 2 main bloodborne hepatitis. All right, but all of them are viruses that cause infection and inflammation of the person's liver. Now, the good news is that usually takes decades, and I'm not exaggerating, 30 to 40 years before you have any problems with this. So if you contract HIV when you are hepatitis B when you are 20 years old, that's not going to be a problem for you typically till you're about 50 to 60 years old. So that's the good news. It takes a long time for hepatitis to actually destroy the liver. It takes decades for that to happen. The same as somebody who drinks alcohol. It takes decades to destroy your liver. All right, so that's the good news. Now, hepatitis B is sexually transmitted. How do sexually transmitted, how did I get over there? I need you over here. Okay. So how do bloodborne pathogens, how are they sexually transmitted? Because remember, they're in the blood. And when you're having sex, you're not putting blood into anybody, are you? Okay. The vaginal canal or the rectum. Anytime you have intercourse, it's going to cause microscopic tears to happen in both the vaginal canal and the rectum. Those tiny tears is how the semen, which also carries HIV and hepatitis B, can move into the bloodstream. So these are not conditions that are infecting the sexual tract. They get in through these tiny tears into the bloodstream. So that's how a bloodborne pathogen is transmitted sexually, by eventually getting into their bloodstream. Not like gonorrhea or syphilis, which cause an infection of the tract itself. If you get semen into the tract and there are no tears, hey, nothing will happen. So those tiny tears, they're the culprit. And remember from last module, my older students, remember that sperm are so tiny that if you take a hair off your head and drill a hole down the middle of that hair, the sperm could swim through that hole in groups. That's how tiny these things are. So these tears are so small that blood cells can't get through them, but the sperm can get through no problem. So that's how hepatitis B, HIV are transmitted through sex into the bloodstream. All right.
Sir, I have a question.
Yes.
Okay, you said there's a tear through both areas, right?
Yes.
So what if you use like a lubrication or something to prevent the tear?
It minimizes the risk, yes. Lubrication minimizes the risk. And that's one of the things that Alan from the AIDS Foundation talked about in his presentation, that using an appropriate lubricant can decrease the risk of transmitting HIV during sex. And also remember this, if it's male-female intercourse, unless the penis has a sore or a tear in the tissue, transmission won't happen. So women or men engaged in anal sex are at greater risk. We call them semen deposits. In other words, if the semen is being placed in your body, you're at greater risk. So when Magic Johnson said, I'm HIV positive, but my wife is not, either they've been using protection or they haven't been having sex. Hey. If they said it the other way around, my wife is positive and I'm not, I could buy that. Because nothing's being deposited in the male body with male-female intercourse. Doesn't mean transmission won't happen. If you've got a sore on the penis or rough or a tear in the skin, then yeah, you have the same risk as the female. But most of us don't walk around with sores on our penis or tears. We protect that part. Mm-hmm. Yeah, buddy. Mm-hmm. Y'all talk about childbirth hurts. Get caught in your zipper. That shit hurts, y'all. I ain't playing. It's like, and then you're trying to decide, okay, do I unzip? Man, so y'all think childbirth hurts. Try getting caught in the zipper. Shit hurts. But anyway, and that's why, again, sexual transmission for the bloodborne pathogens from male to female is not as high as a transmission from male, or from female to male is not as high as a transmission from male to female or male to male. All right. So it is sexually transmitted. There is no cure for hepatitis B. Once you contract it, yeah, sorry, you're going to be 65% of people will become chronic carriers. So I guess the good news there is that 35% of people will rid their body of the disease and they're good to go. But most people, 65%, will carry it from now on. And they can infect other people, not just through sex, but through blood contact. Y'all know that there are cultures out there where families share toothbrushes. I bring that up because there are so many people out there when they brush their teeth, their gums bleed. If you put that toothbrush back in the holder and that blood stays moist on there, the next person come and pick it up, brushes, and their gums bleed too. There you go. Transmission. So that is the chronic carriers. 65% of people who contract hepatitis B will have it from now on and be infectious to other people. Now, you ready for the really good news? There is a vaccine. So you can be vaccinated for hepatitis B. And if I'm not mistaken, it's one of the ones that's required for PCTs before you can start a university hospital, the hepatitis B vaccine. All right, now the good news is, see how long it takes? So if you get your first dose so that you can start your externship over at University Hospital, the extern will be done before you need the second dose. And if you actually get hired at the place, they will pay for the second and third doses. But remember too, for medical assistants who are not required to have hepatitis B before you start your extern, remember, if you go out there on your extern and during your classes out there, you get stuck with a needle, this is one that is effective post-exposure. So you get stuck with a needle today, you can start the hepatitis B series today, and it'll probably protect you. So that's the good news. You don't have to run out and pay for the vaccine to protect yourself on your extern, unless you actually need it. You do get a needle stick. And once you're hired by the employer, they pay for those. So that's the good news, is that the vaccine works post-exposure, even after you've had the exposure. All right. So here are two things you need to know. Hepatitis B poses the greatest risk to healthcare workers and is the only one of the big three that has a vaccine. Why does it pose the greatest risk to healthcare workers? Because we're going to see it more often. There are 10 times as many people infected with hepatitis B as there are HIV. So though you will treat some HIV infected people in your career, you're going to be seeing more hepatitis B positive people. And of course, you won't know this because they don't have to expose their status to you. So you're working as a medical assistant down in the family practice clinic down on so-and-so, you won't know everybody's status when they come in, but you'll see more people with hepatitis B than HIV. And that's why hepatitis B is given the distinction of proposing the greatest risk to healthcare workers. Sample test question: which of the following, or which of the big three, as identified by OSHA, proposes the greatest risk to healthcare workers? Hepatitis B. Which of the big three, as identified by OSHA, is the only one that has a vaccine? Hepatitis B. All right, let's go ahead and take another break. Let's go till 11:20, 11:09. Let's go till 11:25. It's about 15 minutes. All right, I know I'm late. That's because I'm an old man. Yeah, I move like an old man. You know who moves like an old person is my wife, man. I'm like, girl, you move like an old woman. You leave me alone. Getting out the car and that type of stuff, it takes her 5 minutes to get out the damn car. It's usually because you got to get her purse, you got to get this, you got to put this up, you got to put that back, and da da da. Because she scratches off her damn lottery tickets in my car. Yeah, getting that lottery scratch stuff all over my doggone car gets on my nerves, man. But when she gets out the car, it takes her 5 minutes, moving like an old woman. Anyway, we need to get this done. We'll be done in plenty of time, no problem. So hepatitis B, know those two things. Proposes the greatest risk to healthcare workers and is the only one that has a vaccine. All right. Hepatitis C. Hepatitis C is transmitted primarily through sharing contaminated needles. It's prevalent among the IV drug using communities. I didn't mean to do that. I meant to do this. All right. Transmitted primarily through sharing contaminated needles, rarely sexually transmitted. It can be, but you don't see it very often. So hepatitis B or C is a fairly large virus that even though it enters the sexual tract, is too big to get through those openings. So it's rarely transmitted to sex. It's bloodborne, gets into the blood, but not through sex. Now a needle hub, yeah, the diameter of a needle, yeah, that's big enough to pass the virus through. So that's why hepatitis B is sexually transmitted, but hepatitis C is not. It has to do with the size of the virus. And C is a pretty big virus, as viruses go. All right, so it's rarely transmitted through sex, although it can be. Hepatitis C is prevalent among IV drug users. And that's why I know this stuff intimately. I grew up in an IV drug using community in St. Louis, Missouri. My dad sold heroin and my mom sold pot. My grandmother sold food stamps or bought food stamps from people. You know, remember food stamps? You got the little book on the first of every month and it had 10, 5, 10, 20, and da da da. My grandmother would buy those from people for like 75 cents on the dollar and give them, you know, cash so they can go buy beer and cigarettes and all that kind of stuff. Have always had a big old wad of food stamps stuck down in her bra. My grandmother was a big lady, y'all. Had it stuck down in her bra, and she'd give you money. Y'all babies gone, take that, go get y'all some candy. So I always had a pocket full of food stamps. I didn't have any money, but I always had a pocket full of food stamps. And that was okay because you could buy candy. Anyway, my dad sold heroin, and he wasn't like, you know, Frank Lucas type drug dealer. Actually, his brother was. My dad's brother, Uncle Junior. Junior was the drug dealer, man. And my dad would get stuff from him whenever we was like, you know, wanted to make a little extra money or whatever. He'd get something from Junior and go and sell that from the house and all that. So anyway, I grew up around these people, you know, these drug using heroin addicts. And yeah, it was bad enough that when you walk to school, you know, you step over somebody laying on the sidewalk, and if they're still there when you come back from school, they're probably dead. That was kind of the rule. If they're still there, they probably did. And you know what? We would do this as kids, walking to school, stepping over stuff, and not even miss a word in the conversation. Like, yeah, last night I watched this TV show, and you just keep on walking like it's not even there. And sometimes it would be dead people. Most often they were just, you know, just out. But occasionally one of them be dead. You step over, go right on to school. Only happened to me like once that I can recall. But I do remember having to go around the dead body to get up to the apartment when we lived in the projects. That's the time I got a whooping for getting blood on my shoes. I had to step around a dead body to get in the damn apartment. But anyway, these dudes would inject their veins until the veins were so scarred that you couldn't push a needle through them anymore. It's what they call track marks. I have scar tissue right over here from students practicing phlebotomy on me. So I finally reached the point, now y'all can't practice on me no more. I'm getting scar tissue, man. I'm getting track marks. Once the scar tissue appears right there, you're not going to get a needle through that into a vein. You'll miss every time. So they start what we call skin popping. That's when they put the drug just underneath the surface of the skin and let it absorb. They don't get the same intense high that they get when they put it right into a vein, but they get that maintenance high, the thing that just keeps them from going through withdrawals. Heroin can be necrosive to the tissue when you start skin popping. This person right here was popping on it between the fingers. And you see what it does. It destroys the tissue. Anything black has to be cut off. So this dude is going to lose, I guess it's a guy, is going to lose most of the fingers. Like, you can't see it real well, but that one right there. This one definitely. This one, maybe a little bit of the thumb right there. That one's gone. Maybe just a fingertip on that one, and that entire finger's gone. So he's going to lose all of that. Anything that's black or turning black has got to go. And I'm sure this smells like a bag of farts. Yeah, I know it's a strong, nasty smell, because that's what happens when tissue gangrenes. And that's how, by the way, in the Civil War and World War I, how they knew whether to cut a leg off or not. They smelled it. Oh yeah, take that off. So anyway, and then the skin popping, those are healed sores. So all those are scabbed over and healed sores. You see some in the process of healing and so on. So this is what the people walked around our neighborhood looking like. I remember seeing a TV show with, or a movie with Ice-T. The movie was called New Jack City. And in that movie, there's one scene where Ice-T, who's playing the policeman, he's leaning on the fence of the schoolyard, and he's looking down on the ground, and there were a bunch of crack vials on the ground of the schoolyard. And, you know, the sad music was playing and all that. You know, I felt for you. But at my school, those were used, rusty needles all over the freaking place. Because that's where they would shoot up at night, in the schoolyards. Because they had the lights on all night. And, you know, they could be in a big group. One day, what we used to do as kids, you pick up the needle and you fan fold a piece of notebook paper, and you stuff that in the needle hub and turn it into a dart. And we threw those at each other. I came in the classroom one day, and it was a cold day, and the teacher called, said, "Boy, come here." And I walked over, I had my coat on. She said, "Turn around." And I turned around, and I had one stuck in the back of my coat. It wasn't sticking me, you know, it was a thick coat, but it was stuck in the back of my coat. And she pulled it out. "What'd I tell y'all kids about these needles?" And threw it in the trash can. So it was a pretty horrible place to grow up, in the heroin environment. And heroin has had a resurgence in the past, I don't know, decade or so, maybe a little bit longer, with the black tar heroin or the tar heroin, starting up in the upper East Coast or upper West Coast in Portland, Oregon, and places like that. All right, so that's hepatitis C. Now, there is a commercial on TV for a drug that is saying that it is a cure for hepatitis C. The truth of the matter is that it only cures one strain of the hepatitis C virus, and in that case, still only 44% of the people that they treat with it. So until they get that number up to above 90%, healthcare is not going to recognize it as a cure. It's a viable treatment, and it will cure the virus from some people, but not enough people for them to be yelling about it's a cure. So who's calling it a cure? The people who make the drug. Healthcare hasn't gotten on board with that yet. So we still teach hepatitis C as having no cure, even though I did go on and take it off the slides. But as far as we talk to people, there's no cure for hepatitis C. All right, and that's why it remains as one of the top 3 bloodborne pathogens. Once they develop a cure, it'll come off the list, because it won't be as much of a risk. All right, the third is the bloodborne pathogens. Now this one I have intimate knowledge of, not because I have it or even know anybody who's HIV positive. I know about this because this is when I was starting my practice. I started in 1982. I was working in emergency rooms when this stuff was being discovered and talked about, and people showing up, blah, 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 blah. So, and I was an HIV educator back on the, back when, late 80s. All right, so what is this stuff? First of all, let me ask y'all this. Where did HIV come from? Is it new that only just came into existence in the 80s? Or has it always been? What do y'all think? Something new, or has it always been? Nobody? Nobody? Is anybody out there?
I think it was something that's always been present, but it didn't like come into a worldwide existence.
Okay.
You know, it's just like something like, you know, if, like for instance, like a bacteria, you know, it stays, what's the word, like when the bear stays hibernated, I think was something that was just hibernated and it just didn't like blow up until, you know, from what I've heard, it was a monkey or whatever that came in, and that's when it just like exploded.
Okay. Yordell? You had something?
I was just saying, I think it's always been here.
Okay. Always
It's
been.
just never came out. Yeah.
If it always been, then where has it been? People have been on the planet for millions of years. Go ahead, Vidalia.
Well, I read in an article, when I was very young, that no one's really sure, but the article did emphasize on that it was probably lab made because of the carriers, a fish of some sort and a bird of another breed of some sort, and somehow the mixture is what caused this disease. But I don't think there's any actual fact and evidence that I've read in the medical research on where it comes from. But based on your question, I would think, and this is based on lack of education and why I'm here, but I would think that it's something that would be dormant in us, and some kind of connection, infusion, whatever term you'd prefer to use, would make it wake up. It's something like HPV, for example.
Okay. Y'all know that there are places in the world that people have never been. Places on our own planet. You know, we're talking about going to Mars and all this mess. There are places on Earth that the human eyes have never seen or haven't seen in thousands of years. Just recently, within the past 5 years, they found a village in the Peruvian jungle, a city, I should say, that contains more than 1,000 buildings. And nobody knew it was there. They don't know who these people are or were. Of course, it's not occupied, but they don't know who these people were. It's a culture that hasn't been recorded yet. And they still can't record them because they can't get there. The only reason they know it's there is because of satellite imagery and penetrating the jungle. But the jungle is so dense that they can't even just helicopter in or drop somebody in there. So it's going to be a couple of decades before they actually get to the buildings themselves and find out who the hell those people were. In 2018, I think it was, they found 12 new species of frogs that have never been recorded before, all at one time in one place. 12 different species of frogs that have never been seen by people, or at least recorded by people. The deepest part of our oceans, we can't go there. The pressure is too great. We can't even send a camera down there. So we have no idea what's down there. Are there Loch Ness monsters and all this stuff? Probably not in that lake in Scotland. But at the deepest part of our oceans, who knows what the hell is down there? And did y'all know that we have never seen the other side of the moon? We've never visited, never even photographed it. So we have no idea what's on the other side of the moon, the closest body to us. So where did this stuff come from? It came from out there somewhere. It's always been out there. It just haven't been amongst us. Remember what I mentioned yesterday about cohabitating with other animals like deer and monkeys and so on? They go out to these places that humans have never been, and they bring this stuff back with them. HIV probably came from a monkey primate. That's a scientific guess. Why? Because in order for a virus to infect us, it has to be very close to our DNA. So they look at the animal that has the closest DNA to humans, and that's probably where it came from, the primate. Now, that's why we have to be also careful about the way we talk to people out there in the world now, because you are a health professional and you are talking from a different book than the one they're talking from. What do I mean by that? We don't get in the habit of having sex with our patients. So when we talk about our risk to HIV, for us, it's a bloodborne pathogen. But out there in the world, it's a sex thing. So when you say HIV, the person you're talking to is going to be thinking sex. But we don't think that way. When we know it's a bloodborne pathogen, we know it can come from a bite, from a bloody nose. So when you say to somebody that HIV probably came from the primate population, if they're not in healthcare, they're going to think right away, somebody had sex with a monkey. Because remember, for them, HIV is sexually transmitted. That's their mindset. So you get it through sex. So what are you saying? Somebody had sex with a monkey? No, somebody was bitten by a monkey. Somebody ate monkey brains, which is, by the way, a delicacy in some parts of the world, to eat raw monkey brains. And if they get some blood from that and their gums are weak, there you go. So somebody was bitten by a monkey out there trying to catch a monkey for a zoo, or trying to catch a monkey to eat. Got bitten or ate a contaminated monkey. All right, so anyway, it probably came from the primate population as best guess, because it does affect the DNA, and remember, genetic immunity. So it probably came from some animal whose DNA was real close to our own. All right, now, contrary to popular belief, everybody believes that the HIV outbreak started in San Francisco, or the pandemic started in San Francisco. Actually, it didn't. Why does everybody think San Francisco, though? Because San Francisco is considered to be like the gay capital of the United States. First openly gay mayor was in San Francisco. Okay? And remember, we were stationed from about 45 minutes from San Francisco in my first assignment in the Air Force. So we were right at ground zero, y'all. When I say I was at ground zero, that's what I mean. We were right there. But actually, the outbreak started in Los Angeles, in LA. All right. So you had a doctor in LA who contacted the CDC. Does anybody remember where their headquarters is located? It's in the South. Atlanta. The only BSL-4 laboratories in the United States are in Atlanta and Virginia. That's not a test question, just knowledge. The only BSL-4 laboratories owned by the CDC in Atlanta and by the Army in Virginia. So that's where the CDC headquarters is in Atlanta. So some doctor from LA contacted Atlanta CDC and told them that they had a young male who has composed a condition called Kaposi sarcoma. And is on death's bed. And he said, wait, nobody dies from Kaposi sarcoma. Very few people even get it, but nobody ever dies from it. What are you talking about? So they sent a researcher from the CDC out to LA, a person we call an epidemiologist. These are the people who are doing the tracking right now for COVID-19. When you turn up positive, this is the people who are calling you on the phone saying, hey, where have you been? Who have you been in contact with? And that person came down to LA and reported back to the CDC that because they're able to go to several different clinics now, collecting information, and they found that it's not just one, it's several, all men in Los Angeles, and they not only have this, but they're dying from it. How could that possibly be happening? Nobody ever hardly gets this, let alone dies from it. Okay, so then on your East Coast, from New York City, doctor says, hey, I have a young man down here who has a condition called pneumocystis carinii, and he's dying from it. And they said, wait a minute, people hardly ever get that, and nobody ever dies from it. So they sent their epidemiologists to New York as well. And it's not just one. So what the hell is going on? And all of these people are men. Is this something that only affects men? Because we know there are things that affect women more than men and that type of stuff, men more than women. So is this some type of new disease that only affects men? What else do these men have in common? And this is the epidemiologist talking to them, doing interviews. Where have you been? Who have you been with? Who have you been talking to? What else do all these men have in common? They're gay, all of them. Oh, shit. We found the link. They're all gay. And since we're seeing a decrease in their ability to defend themselves, do y'all remember from last module? Our immune system is our white cells. White cells are the immune system. And all of these people are seeing a decrease in their blood cell count, their white blood cells. This must be a new type of leukemia, which affects the white cells. So the first name for this stuff was the gay leukemia. And people said, are you kidding? So real scientists started getting involved and saying, wait a minute now. In these people, we're seeing a decrease in their white blood cells. In leukemia, you actually see an increase in their white blood cells. So this is not a new leukemia. Okay, but their immune system is deficient. Their white cells are going down. Their immune system isn't protecting them. That's why they got these two conditions in the first place. Their immune system isn't protecting them anymore. So then it must be a gay-related immune deficiency or GRID. And that was the name. Now there are posters. You can still go online and find some old GRID posters all over San Francisco. My wife and I were seeing them when we go on vacation. Oh, GRID stuff again. I'm not gay, so it ain't no big deal. Okay. So GRID. So now they are doing contacts because they want to know, is this and that the same thing? I mean, I know we're seeing different diseases, but are those diseases being caused by the same thing in people? So they're doing their contact wheels. This is when you ask this person, so I mean, who have you slept with? Well, I've been with this guy and I've been with this guy over here. Then we interview them. Oh, I've been with this guy right here and this guy right here. And then we interview him. Oh, I've been with this guy right here and wait a minute. Yeah, I've been with that guy. And you have a cluster of everybody who's been with everybody. You remember that? Anybody that you've been with everybody that they've been with. This is what this is talking about. This guy right here and that guy right there never met, but they're connected between this person. That's a contact wheel. And they're doing it on both coasts. And they're expecting a center to appear. Somebody who has been in contact with quite a few people, the center, patient zero. But then something really weird happened. This guy right here, he said, yeah, well, you know what? I've been with this dude. And then this guy over here said, well, hey, guess what? I've been with that dude. So the center was not happening in one city. It was happening between them. So all of them were connected. People in different cities, never been with this dude over here, but they're connected through all of that. 6 degrees of separation. So anyway, that is when they decided, wait a minute, this is not a city issue. This is a national issue. And they petitioned the president of the United States to get involved. And Ronald Reagan said, it's only affecting gay people, so who cares? Not in those exact words, but that's exactly what he meant. Since it's only affecting gay people, who cares? Jimmy Swaggart was on TV pounding the podium. This is God's plague on the gay people. They go against God, this is what they get. Nobody wanted to do anything until the World Health Organization met on this stuff, because now they're starting to see people outside the United States. Other countries are starting to test, and they're seeing people outside the United States. So the World Health Organization got involved, and somebody, a doctor, went to this place. Remember I said you have to be invited? This guy just showed up, bogarted their session, stormed in. They had to drag him out. Police had to come and get him. But before they dragged him out of there, he said to those people, you have to be pretty arrogant to believe that a virus affects somebody based on their sexual orientation. That's pure stupidity. He was probably gay. And as a result, at the end of that meeting, they had a new name. The acquired immune deficiency syndrome. You see deficiency right there. Acquired immune deficiency syndrome, or AIDS. They took the word gay out, but it was too late. They'd already done the damage. There are people today who believe that if you're not gay, you're not at risk. My daughter, just a couple years ago, asked this one kid, hey, have you been tested? And he said, I ain't no faggot. And I said, sweetie, did you like tell that young man goodbye? Yes, I did. Good. It's ignorance. I ain't no faggot. Even using that word today is ignorant. So it's not somebody you want to be around. So anyway, that is the battle right there. Now they know that, hey, we've got a name for the disease, and that's all we got. We still don't know what causes it. Is it a bacteria? Is it a virus? Is it a fungus? What's causing this in people? So the first person to find the actual cause, which believed it was a virus. So the first person to find that virus, there you go, world renowned. Think about the endorsements, the speaking tour, You're going to get the Nobel Peace Prize. That's a gimme right there. So you're good. So there's some competition to be the first one to find this virus. Just like right now, there's a competition to be the first one to finish your vaccine. How much money is that going to be? Shit. You're the first one, and your vaccine has gone through all the clinical trials, proven, and it's ready. And the Food and Drug Administration says, okay, shit. You wrote your own ticket. You're talking about trillions of dollars. So there was some prestige to go along with this, money, some, you're set for the rest of your life. Who's going to find it first? The front runners were the French and the Americans. And the French won. They found it first. And when they did, they sent a copy to the American laboratory to have it confirmed. You have to have a second party confirm it. The top laboratory in the world just happens to be your rival, but there you go. You got to send something over there for somebody else to say, yeah, this is it. The Americans got it and they stole it, claimed credit for it. So now we know what virus, we know it causes, but who discovered it first and who gets to name it? And that was in court for 4 years. Companies around the world waiting for copies of this virus so they can start experimenting with it. Imagine the first drug company to come up with a treatment for it. And what kind of money that's going to be. That's billions of dollars. They're all waiting and nobody can get it because it's held up in court for 4 years. So they finally agreed for the French and the Americans to share joint credit. The person who stole it, they ruined his career, and they agreed on a name. The Human Immunodeficiency Virus, HIV. So HIV is the virus. AIDS is the sickness. You can be HIV positive for decades before you progress into AIDS. Okay? And Alan kind of pointed this out during his presentation, that term that people use. Full-blown AIDS. No such thing. Either you're in this state or you're not. So acquired immune deficiency syndrome, AIDS, this is the sickness. This is what happens to you when your immune system has not enough white cells to protect you anymore. And you start getting sick from things that other people just don't get sick from. When you're in AIDS, hell, you can die from a common cold. Did anybody watch the movie Straight Outta Compton? When the doctor came in, told Eazy-E had a white cell count of 17. That's not saying that he has only 17 white cells in his entire body. It's saying that any blood sample they take from him will have about 17 white cells in it. And it should be about 1,500 per sample, and he has 17. His immune system is not protecting him anymore. That's AIDS. All right. So after all of that, it was still killing people in 7 years. I was sent down here to a seminar in San Antonio, Texas, an HIV seminar, where we were to, they had a representative from every military, from every Air Force base in the world. And we all came down here to learn all about this HIV stuff so that we can go back to our base and be the educator for the base and talk to all these young people about HIV and the risks out there. But remember, the gay thing had already been, the damage had already been done. We were contending with the idea that most people believed that if you weren't gay, you were okay. You could do whatever the hell you wanted to. Now, during that seminar, we met with doctors, hematologists from all over the world, the best in the Air Force, definitely. We met families where the entire family was HIV positive, the mother, the husband, and both children, and that kind of stuff. We got so much into science that it was like, oh, geez, man, come on, are you kidding me? Scientists talking way on levels, way beyond what most of us could comprehend. When we got to the end, it was 3 weeks. On the last day, everybody's got their luggage and they're ready to go to the airport and bye, you know, hugging, and we're going to keep in touch, you know, damn well you're not. We're going to keep in touch and da, 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 da. And the lady who'd been running the seminar, she was the #1 hematologist in the Air Force. Hematologist is a blood doctor. She was #1. And she had been the master of ceremony for the entire 3 weeks. Last day, she said, okay, guys, before y'all go, I know everybody's anxious to get to the airport. Before y'all go, I want to ask you one question, something I haven't asked you for the entire 3 weeks. And that is this: how many of y'all know somebody who's HIV positive? And some of the people started raising their hands, and everybody's looking around, oh, look over there. And she said, everybody in the room should have your hands up right now because I'm HIV positive. She was the doctor that was stuck in the elbow on the ward, just standing there talking. Are you kidding me? Now, how many of y'all would have snatched that syringe and stuck that person with it? Stuck them back. But yeah, and that was at a time when HIV was killing people in 7 years. So she probably didn't survive very long. So now I'm back at my base and I'm going around and I'm doing classes in places like the motor pool and down at, you know, finance and that type of stuff. And I'm doing one class in the motor pool, you know, where they fix cars and stuff. So there are about 20 kids in there, all young people, y'all 18, 19, 20 years old, a couple of late 20-ishes, early 30s, and then this one guy who's standing in the back of the room, leaning against the wall with his arms crossed. Dude got stripes from shoulders to elbow, just. And there are plenty of open spots, but this dude will not sit down. And I'm thinking the whole time I'm talking, he's gonna be a problem. So we went through an hour and a half of just talking and then them asking questions and da. And when we finally got done, I said, okay, y'all know where I am. I'm over at the emergency room. You need anything, you can call me and I'll come over, or you come over and talk. And that's when that guy stepped off the wall. And he said, hold them. Now, what that means in the military is hold your seat, don't get up. Hold them. And he starts walking around the room at this really slow pace for dramatic effect, you know. And he gets around in front of me, and I'm watching him the whole time. I swear it takes him a good minute to get up to the front of the classroom. He gets up and he steps in front of me. I mean, he's just showing that that he has the power. And he looks out at them and he says, let me tell y'all something. If anybody in my unit get this shit, I'm telling everybody on your faggot ass. That's the attitude that I was dealing with out there. So anyway, today we are more educated. Who was patient zero for HIV? His name was Gaspar something. He was a French Canadian airline steward. Flew one of the major airlines in the United States. And which route did you think he had? New York to LA. And during his trips to LA, LA is about 8 hours from San Francisco. He was taking the trips up to San Francisco and doing the whole bathhouse thing. Bathhouses are, if you've never heard the term before, anonymous sex. You go in there, you meet somebody, you go in a room, you have sex, you wash up, you come back out, you meet somebody else, you go in a room, you have sex with them. Anonymous sex. All over San Francisco. In New York, Studio 54. Y'all know nothing about that. Sex on the dance floor. Drugs being sold across the bar. Yeah, it was notorious, y'all. Who hung out there? Hey. The big Jackson, Michael Jackson, spent most of his time in New York hanging out in Studio 54. But it was the same idea, y'all. Sex in the back room, sex on the dance floor. It was notorious. They eventually shut the place down and put the orange in. Yeah. So I think there's a movie called Studio 54 where Michael Myers, not Michael Myers, shit, that's the serial killer. That's the Halloween dude. Michael, whoever, Austin Powers. Yeah, he plays the owner of Studio 54. So anyway, so that is where that stuff came from, y'all. Now, in the late mid-90s to late 90s, there was some, yeah, okay, we got this virus. Yeah, it affects gay people. Yeah, why do we care? Okay. Well, gay people were very big in donating blood. So is this stuff in the blood products? Are we transfusing this to people? And if we do transfuse somebody with this contaminated blood, will they develop HIV? So there's still a lot of science to be done. And up until 1985, they were not testing the blood. And as a result of that, 85% of the hemophiliacs in the United States, people who receive blood transfusion about every 120 days, contracted HIV through blood transfusion because the blood bank refused to test the blood. They said, you want us to spend that much money testing blood, then you need to prove to us that it's in the blood. And the science wasn't there yet. So it reached that point in 1985 in which they started testing the blood, and there hasn't been a contraction of HIV through blood transfusion since then. And by the way, if you want a free test for all three, hepatitis B, hepatitis C, and HIV, go and donate a pint of blood. They have to test it by law. And then they have to notify you of the results. So simply to donating a pint of blood, if you've done that in the past, whatever, then you know you're HIV negative because they didn't call you. If you were, they would have called you. So they have to test all three by law now. So a big quick way to be tested is go down and donate a pint of blood. All right. So that's the whole HIV thing, y'all, and where that stuff came from.
Mr. Mahone,
Yes.
I had a question earlier. You said that someone might have gotten bit by an animal that had it, right?
Uh-huh.
So does that mean that animals can have that?
Primates, yes.
Primates, what do you mean? Like
Monkeys,
Yes, monkey.
gorillas, orangutans, chimpanzees, yeah, primates.
So what about like meat that we eat? Can they get it?
No. Because remember I said that it's probably, if somebody ate a monkey, it's probably somebody that ate raw monkey brains.
Okay.
Because remember, once you cook something, you're good.
Okay.
It's going to destroy anything in there. So since most of it, we cook at temperatures higher than 250 degrees, and that's what we use to sterilize. So it's going to destroy anything in there. Matter of fact, has anybody ever, when we grew up back in St. Louis, there was a big packing house in St. Louis, you know, where the slaughtered animals would come and then they packed them into packaging and all that. And if you go directly to the slaughterhouse and you buy pork chops, it's important that they not be, you know, refrigerated. You buy them right as they cut the pig up, and you buy pork chops and take those home and put them in a vat of Coca-Cola. Coca-Cola is acidic. Put that in a vat of Coca-Cola, and you can see the worms come out. All those little worms in there that cause trichomoniasis in people. They're still living until you you know, temperature control the meat. Once you put it in the refrigerator, it kills the worms in there. And still eating those undercooked could make you sick. That's why undercooked pork causes trichomoniasis in people. So yeah, once you cook the monkey meat or whatever, it's not going to be transmitting anything to somebody. And we don't get in the habit of eating raw meat. As a matter of fact, in restaurants, you know, you can't buy a piece of raw meat in a restaurant. People are like, oh, I want mine raw. No, you can't do that. They won't do that. It's against the law. It has to be cooked for a certain period of time at a certain temperature before they can serve it to somebody. So yeah, once we cook it, once we freeze it or make it cold and then we cook it, all that stuff will be destroyed. All right, so what I want to do right now is, I kind of feel a little sorry for the people who are not here right now. Oh, this is somebody doing my stuff. And anyway, so I want to go to here. All right. Shut up. Okay. You can receive an email from me that will have 2 attachments and a link. The attachments will be the infection control review and the bloodborne pathogens review. A review is a sheet of paper that has all that red stuff just kind of put in one place for you. Okay. So you study the review, you go on and you take the test. The link will be the test. Let me show you how the tests will work. What am I looking for? We just did infection control. Matter of fact, I'll go on and I'll go on and send it now. I'm gonna keep this active until Friday. Friday will be what? Let's see. Friday will be the 21st. So Friday, August 21st. Now I'm going to share the link with y'all in an email. Sending this to 727, that's the old students, and 817, the new students. Paste in the link. Now this is the link up here, this blue line. That's your test. And I'm going to go on and attach going to the cloud. Doggone it, and put these all in one place yet. Going to my files, resources, work, put 2. And I'm looking for there's actually one attachment. Okay, so you would download this, study what's on it, and when you're ready, come back to the email and click that link right there. Okay. So let me go on and send that, and then I'll show you what it'll do, what'll happen when you click the link. This is your infection control. Friday. And the 21st. Okay, now I can't get any clearer than that. Infection control and bloodborne pathogens review and test. Test is due no later than 12 o'clock p.m. on Friday. Now, this is where you got to be sufficient or self-reliant. If you're not going to come to class, then you better be able to figure out that that's a link for you to click on. Otherwise, because I'm not going to say this stuff again. See, right now we're down to 15 people in class, which means 14 because I'm no extra 15. We have 21 people in class. Where are the other 7 people? Who knows? Okay, I hope they're doing something important out there. All right, so I'm going to send that. I'll get it here in just a second. All right, there I am. So that's how it's going to come to you up there. Infection control, da 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 da. You'll study, and then click on this link. Did I change this? Can't tell. Let's see. Yeah, I think I did. Oh, this is a link. That's fine. All right. So anyway, I'm going to click on the link. That'll take me into the quiz. Here, you'll enter your name. Please enter your full name. And start. Once you start, it's going to ask you to pick one of these themes up here. It doesn't matter which one, just click one. I'll click that one. And start. What bacteria has a round shape? Keep track of your points. Treating all persons or body fluids as if they are infectious is the basic principle of which OSHA guidelines? Universal precautions. Universal standards. Choose standards. Same thing. The 2 guidelines mandated by OSHA are the bloodborne pathogen standard and universal precautions. Which of the following means that a pathogen is expected to be seen in a population? All right, so I'm going to stop that now. But you see how that works. Know that you're ready to go because the questions are timed. I think it's about 30 seconds per question, which should be plenty of time. I know 30 seconds doesn't sound like a lot, but if we were to sit here and be quiet for 30 seconds, you'll see just how long it actually is. So make sure you're prepared before you start. Make sure you put your name in there. Now you can retake this, but if you do, it'll show me which attempt it was. So it'll tell you to have your name right there in the report. I just go over here to reports. I can look at all the old tests. Let's go back to one of some students that are gone. And I can go in here and it'll tell me your name, what your score is, and how many attempts it was. You see here it says 2 attempts. If you take this more than once, your maximum grade, no matter what it says over here, will be 75 because that's counted as a retake. So you want to get it done right the first time. So for this student, Christy, first attempt, 93, that's what goes in the grade book. Second attempt, 93, she gets 75 in the grade book. It's her second attempt. So you can take it as many times as you want. And what you don't want to do is go in here once, stop, and then come back in because it's going to show it as your second attempt. So make sure that you are ready to go, that you don't have any distractions around you, and that you're allowing yourself enough time to complete this in the first time you go in there. If it says second attempt, when I look at it, the maximum score for that will be 75. So plan this out well. Do not jump into here just to see what the questions are like. If you get in and come back out, the maximum grade is going to be 75. All right. And you see it's only activated until the 21st at the time that I activated, which was about 12:15 or so. So you got to get it done before then. And don't let this kind of stuff stack up on you. There is no homework for infection control, but we will go through. We got about a few minutes left. So let's look at a little bit of the homework. Where the hell is my textbook?
Sir, when are these homework assignments due that you
They're
sent us?
All homework will be due on the last day of class. So you work on it and keep it going. All of it has to be turned in to me by the last day. You can turn it in early as you get it done or whatever. Or you can do it all, save it up, and at the boom, turn it all in. Either way, it's up to you. But all homework is due on the last day. So, and it kind of helps you, plan out, if you're working or whatever, it helps you plan that out a little bit better. And you can get it all done on a weekend or on your day off, that kind of stuff. Where is the, oh man. All right, well, we'll have to go over the homework tomorrow because my textbook is not on this computer and it's not in the cloud. I'll get that fixed and we will go through the homework pages what the textbook is actually asking for at the end of class tomorrow. All right, so y'all see how the testing works. Get on there, study that review. When you're ready, go in there and take this test. You can also study your notes. You can rewatch the video. I'll send the second part when it finishes converting today. So you'll have the entire video start to finish. You can rewatch the video if you think that'll help you. Remember this is not in the textbook. So study those slides and study that stuff that's red. The stuff that's in the review will match the red that you saw in the slides. Right? So get that done. Remember, do not let this stuff back up on you. If you're waiting until the last day, there's a good chance your grade's going to be compromised because people who wait till the last day hardly ever get it all in on the last day. Yeah. So make sure you don't let this stuff back up on you. And where's, where'd she go? Green, Jennifer Green. I'm getting homework from her already. So get in there and get started on that stuff, guys. Remember, think about it this way. If you get it all done, then that's the pressure off. If there is homework that's missing, it's going to start to pull down on your grade. And by the way, that's what we can do right now. How do you know what your grade is in my class? You keep track of it yourself. And how do you do that? All right. And see, this is one of the reasons I don't like it when people are absent, guys, because we're going to have these questions. Well, Ms. Mahone, what was that email you sent? When is it due? Well, and we're going to be having this during lecture. So, Ms. Mahone, how do I know what my grade is? Well, Ms. Mahone, can you send me my grade? No, calculate your own damn grade. And here's how you do that. If you score 92 on a test and you've taken one test, your grade right now is 92. 92 and your second test, 87. Add the two together. 9, 19. I mean, 7, 8, 9, and then 9 and 8 is what? What am I doing now? 7, 9. And then 9 and 8 is, anybody? Is it 19? 17.
17.
17.
All right. Divided by 2.
I need to teach you sign language.
because there are 2 grades there. So go into your calculator. Almost every device has a calculator on it. And it was 179. 179 divided by 2 equals 89.5. So that's your grade. So now you take a third test, 92 plus 87 plus 74. Add those up and divide by 1, 2, 3. Be able to do that. Always know where your grade is. Like that one teacher who told me I don't give A's. Excuse me? And I pulled out my notebook. Boom. I scored 100 on every damn assignment you gave me. My overall grade says 100. I should have an A on my transcript, period. Be able to make those kind of arguments. If you're coming in telling the teacher, well, what was my grade, Mr. B? Well, your grade was 74. No, my grade shouldn't be that low. Prove it. Show me your paperwork. If I have recorded for you 65 and you have in your notes 85, I'm more likely to go with you if you can show me in writing somewhere. Ms. Moan, look, I wrote it down when I took it. It said 85. I'm more likely to say, all right, I'll give you the benefit of the doubt. As opposed to somebody who's saying, no, I know I scored higher than that. Well, what did you score? I don't remember. 65. So be able to argue and be able to bring some evidence to the table. Always keep track of your grades. I would have, no, Ms. Moan, I didn't score 60 on that test. I scored an 85. Look, here it is right here. I wrote it down. All right, I'll go with you. I would take my notebook, go to the front cover. If you, I'm envisioning one of those spiral notebooks, going right to the front cover and writing my test grades down in there. The grade, the chapter it was, this one is infection control, the grade, and I even write the damn date I did it. Ms. Moan, I took infection control test. I scored a 75 on the 21st of August. Be able to know what your grade is. Always keep track of that. So write your grades down as we go. And you should always know where you are. One more thing I want to explain, and I closed the whiteboard already. When you're doing all of your homework, remember you won't get the homework credit until the last day of class, when everybody turns it in. So what do you do there then to know where your grade is? If your overall grade if your test grade, you averaged up all of your tests and you come up with a 82. Add the homework, it'll take you up 1 letter grade. So let's say your homework grade is, or your test grade is 98. Then why do the homework then, right? Because the homework, you can't score more than 100. So the homework will only bring your grade up to 100. Can't score more than that. So why even do the homework? Already got 98. Because if you don't do the homework, it pulls you down a letter grade. Oh, damn, I didn't know that. Yeah. So now you know why somebody or some folks in this class, y'all, last module, they walked away with a test score of 80 or a test average of 87. The grade they got from me, 97. Damn, really? And when she here put it in the email. Oh, is that really what I got? Yeah. Homework will pull you up a full letter grade or down a full letter grade. So how do you think I felt when somebody scored this same 87 for a test average, but didn't do the homework?
Mr. Mahone,
Yes.
somebody asked something in the chat.
Okay, go ahead. What was it?
I don't know. They asked chapter 1 and 2. When is that due?
On the last day. All homework is due on the last day. Just like last module for y'all that were with me last month. So you can start turning it in. Like I said, I'm getting homework in right now. You can start turning it in whenever you want, but it's all due on the last day. That's when I'll check and see what homework is here and what isn't. And starting, probably not tomorrow, probably starting Thursday, I'll be putting up a homework tracking sheet every morning that will show you what homework I have from you. As you send it in, I put a little star next to your name. I think I showed that to y'all in orientation. Put a little star next to your name and let you know that I have it from you. That way I don't have to keep going back, yes, I got it, yes, I got it, yes, I got it. I'll just put a little star next to your name. And I'll be putting that up every morning. Or I'll not be putting it up, but I'll be included in the email every morning. So I'll probably start doing that on Thursday when I start getting a little more homework in. But everything is due on the last day. You can turn it in anytime you want. Now, tests have due dates. Like we said, the infection control test is due on Friday, before Friday. You can take it tonight if you want, but it's due by Friday. And what that does, again, guys, those folks that have to work, those folks that got kids, you can plan your study and your test taking over your schedule. I'll give you 4 days to, or three days to actually get that test done. And homework, you can actually do it all in one weekend. Or you can get it done early at the beginning of class and then skate through the rest of the class. It's up to you. So that's why I don't have a fixed due date on homework. But I have to have a fixed due date on tests. They have to be done by a certain time. All right. Always keep track of your homework, guys, or your test grades. And you'll know pretty much where you are in class. Because if you look at your average and it's 77, you say, wait a minute, I'm doing all my homework, so I should be good. Or you should be saying, damn, I haven't done no homework, so I'm not good. You have the ability to do that on your own. All right. So that is homework and how we do that. It's out there to you whenever you're ready. Anybody have a problem opening any one of these, the homework or getting into the quiz, send me an email and we'll work it out. I had somebody say a couple modules ago, not last module, but I didn't take that test because when I went in there and tried, it wouldn't let me. Did I get anything from you? Email, question, hey, Mr. Mahone, I tried to do the test last night, it didn't let me. That's all it takes. But this person went full 3 weeks and finally said, well, it wouldn't let me take it when I tried. So I just said, forget about it, I guess. So anyway, that is that. So any questions about homework? We're going to go through some of them tomorrow when I can pull up the textbook. Any questions about the quizzes or anything like that? How to average your grade, your test grade. Remember, do not close that program until you write down what your grade is. It'll tell you right there on the screen.
I have a question.
Yes.
I noticed that you can take the test multiple times. How do you average out that grade? Do you average it out amongst all the times they take it, or you just take the best score?
Nope, nope. If there's more than one attempt, that's counted as a retake. The maximum score you can score on a retake is 75.
Oh, okay, okay.
So if it's your third attempt, no matter what the grade is over there, what I'm going to record 75 in the grade book because it's a retake. And that's what I'm saying about go in there, make sure you're ready to do it. Don't get in there, read a couple questions, and then chicken out and come out. Because the next time you go in there, it'll be counted as your second attempt.
Okay, thank you.
Make sure you're ready for this. Go ahead. Okay. Make sure you're ready before you start. All right, have somebody else quiz you. Get in touch with one of your classmates, quiz each other back and forth. But be ready for it before you go in there. Any other questions? Okay, tomorrow we'll be covering chapter 1 in the textbook. Y'all can pre-read that, and that'll be a good time for us to actually go over what the homework is and how we do that. So we'll be lecturing on chapter 1 in the textbook tomorrow. There will be a PowerPoint, I think, I'm not sure. I'll send it out with the email in the morning. Sometime this afternoon, I'll send out this recording in case anybody wants to review anything. So if there are no questions, then we'll end class, and I will see y'all tomorrow morning